So I just want to briefly, if you'll take a look at the agenda that Erica has passed out to everybody here. So the Superintendent's Working Group on Student Health and Well-Being. Just a little bit about the background. I guess I'll read it to you. House Bill 155 called for the Superintendent of Public Instruction to convene a working group to study effective and positive intervention measures or policy changes to address risky behaviors and encourage student mental health. The group shall be comprised of personnel at DPI, DHHS, and DPH who are experts in student mental health issues and may also include representatives from various public and private stakeholder groups, local school administrators, and charter schools. This group is expected to make recommendations to the State Board of Education and the Joint Legislative Education Oversight Committee. And our big goal for the day is to get to the point where we can, or to have some applicable items here for the superintendent, for educators in the state of North Carolina to know what student behaviors to flag, which ones to address, and how to address those behaviors, and for every community and LEO to work together to address issues as they arise. The guiding principle of this working committee today is to essentially, from the bottom up, from teachers all the way to the law enforcement and people around that are helping, to have solutions that lead to increased coherence, that we're all speaking the same languages at every level. That's going to make it easiest for everyone across the board, and to find out the solutions for our children. So I thought we would go around, and for the people that are here, I know that we have one that's stuck in traffic, a bad multiple-car accident on US 1. Some others might be a part of that as well, but as far as we know, only one. She's not a part of the wreck, but she's in the traffic. So I thought we would go around and introduce ourselves and the agencies we work for and the great things that we are doing. And while we do that, Erica over here, Erica Berry, who has put all this together, awesome, is going to put your name on, we have 3 buckets here. We have the mental health bucket, the school safety bucket, and the school culture list that you would go under, and just kind of let us know what you are doing. So I'll start first. My name is Caroline Daly. I'm a teacher right across the county line in Johnston County. And I also serve as the vice chair on the Safer Schools Task Force under Executive Director Kim Martin over here. We'll introduce herself in a minute. And so I would relate most to, the Center for Safer Schools, absolutely. And then the school culture, I've also developed a program entitled STAMP. And while I say STAMP, STAMP is an acronym, which reminds me of something else I wanted to ask everyone today. I plead with you today, because we are all from different agencies, if we could just not use acronyms today. And if we do, because I think that it's easy to do, if it's our vernacular, what we use every day. But if we could just explain what those are, because you could say something and I'm sitting here going, I don't have anything. So, and then I'm Googling it. And then I see a text from my kid, and then I'm way off at that point. So, so if we could just agree to that, I'd appreciate it. We'd all appreciate it, I think. So the STAMP program is the Student Tutoring and Mentoring Program, and we can discuss that later. I'd be happy to discuss that with you guys. But it's a weekly mentoring program with the kids at the school, and it's gaining a lot of traction right now. And as far as the social emotional relationships between advocates in the school and the kids, and to be a preventative tool to see any problems before they start. So that's Student Tutoring and Mentoring Program. So that would go under the school culture. So that's a little bit about me. I'll go to the left here.
Hey there, I'm Stephen Walker. I'm the General Counsel and Policy Director for Lieutenant Governor Dan Forrest. Also serve as the Vice Chair of the North Carolina Charter Schools Advisory Board. I didn't say CSAB because I was trying not to use any
Thank you.
acronyms there. But I was involved in Senate Bill 548, which was to strengthen human trafficking laws and to do some studies on that. And when this group was going to be formed in statute, we removed the part of that bill that would require the human trafficking and sexual abuse training so that we could all discuss it and figure out what would be the easiest way to do it. So that's probably why I'm here. So, thank you.
Good morning. My name is Walker Wilson. I'm the Assistant Secretary for Policy at the Department of Health and Human Services. I am here on behalf of Secretary Cohen and really welcome the opportunity to hear from and learn from you all. The department has a lot of different interested divisions, including social services and public health and mental health and child development and early education. So I think it will be helpful to have this conversation and figure out where I need to plug in additional subject matter experts. Also curious about the timeline. I wasn't clear like when the recommendations are going to go to whom. That would be helpful as well. Other than being part of this group, we're trying to insert the importance of student health, early childhood mental health, supporting youth mental health into all these conversations around school safety. And there are several, as you probably know, in the state. So really happy to be here and be with you this morning. Thank you.
Good morning. I'm Ann Nichols. I'm the State School Health Nurse Consultant with the Department of Health and Human Services. My office, through a team of 7 other regional school health nurse consultants that I supervise, provides all the consultation, technical assistance, and continuing education for school nurses in North Carolina. I would say from your bucket list, we're probably mental health for the most part. School nurses are the on-the-ground face for students frequently when they're having a physical or a mental health issue as someone that they can approach directly without an appointment when the school nurse is in the building, and that's the issue for the most part within our state. They do also impact school culture, I would say, because they provide training for school staff and engage with school staff around appropriate responses for students that can be managed within the staff at the school itself.
Hi, I'm Dr. Frank Adenizio. I am the Director of Clinical Services at Holly Hill Hospital. I'm a licensed clinical addiction specialist and a licensed clinical social worker. At Holly Hill, besides serving adult population, we have a hospital for children ages 5 to 17 focused on crisis stabilization. So we get children from all over the state, and our purpose is to stabilize them once they come in suicidal, possibly hearing voices, or some other type of acute crises, and really get them out as quickly as possible so they can go back to school. So school, involvement is huge. So I'm sure I'm here for mental health.
Good morning. I'm Leanne Winter. I'm the Director of Governmental Relations for the North Carolina School Boards Association. We represent the 115 local boards of education in North Carolina, plus the board that oversees the Cherokee Reservation District. We work in all these areas. The school board at the local level is the legal entity of the school system and the policy-making body for the district. So we are heavily involved in all of your 3 buckets.
Thank you.
Hi, I'm Lee Teague with the Teague Advocacy Group. I worked on, in coordination with Leanne last year, on this issue on behalf of several charter school clients.
I'm Bill Hussey. I'm the Director of Exceptional Children's Services here at the department. I am staff to the School Mental Health Initiative. We have multiple folks out of my division who do that. My history has been in the area of mental health. I worked as the department's lead for William in the 90s and have had ongoing experiences as a private provider and support throughout school districts and mental health programming throughout the Southeast. So I'm pretty strongly in the mental health piece.
Good morning, I'm Susan Robinson with Division of Mental Health, DD, and Substance Abuse Services, and I'm glad to be here this morning. And I come from the Community Wellness and Prevention section of the division and work closely among our sections within the division, as well as our Department of Public Instruction partners, and with school safety and the School Mental Health Initiative, with serving as my role with the division's representative on the Child Fatality Task Force, concerned with injury prevention and suicide prevention and related injuries for our students. I'm very concerned about student wellness and mental health promotion, early childhood mental health, and I am the suicide prevention coordinator for the division, as well as the early childhood mental health liaison. And I would say that predominantly it's school-based mental health. However, obviously that I see suicide prevention as a component.
Good morning, Rachel Johnson. I work with Susan at the Division of Mental Health, DDSAS. Currently in the role of the statewide administrator for children with complex needs. So those children who are newly diagnosed with a mental health disorder, as well as an intellectual developmental disability to include autism. We're working on strengthening the training for practitioners across the state to deal with those individuals and properly identify them. Formally in the justice section of the division, working specifically with juvenile justice around youth who are involved with the justice system or at risk of becoming involved in programs across all the disability groups for those. So I would say, obviously the mental health bucket, but also as Susan said, just talking about prevention, early identification, I think that falls under culture as well as we talk about how we change our thinking about the whole child. So I do serve on the whole child committee here at DPI, as well as the Center for Safer Schools Task Force.
Yeah, back here.
Hi, I'm Christy Lynch-Ebert, and I serve as interim director for the Standards Curriculum and Instruction Division. And we have both school counseling and healthy schools within our division. We have lots of intersections.
Thank you.
And I'm Ellen Essick. I'm the section chief for the Healthy Schools section here. We provide the professional development for teachers around the standards for mental and emotional health in grades K through 9, or K through high school, as well as interpersonal communication and relationships. And then we also, through some of our grant funding, provide professional development around some of the mental health issues that you all discuss for school personnel.
I'm Diana Rodriguez with the Center for Safer Schools. Hey, Karen.
Hi.
And I'm very excited to be here at this meeting. I focus with mental health and substance abuse within the center and support our task force in both of those subcommittees. And as a center, we work around school climate needs and primarily school climate.
I'm Drew Pledger, and I'm a school social worker at Webb County Schools. I'm also a licensed clinical social worker and have about 40 years of direct clinical practice. I've served for about 20 years as clinical director of our school-based mental health team before we divested of mental health services at Webb County Human Services. In my role at the schools, I'm primarily responsible for helping coordinate our mental health initiatives. And those include some of the areas of interest that we have here around threat assessment, suicide prevention, suicide training, and screenings, so that I'm involved in all of those. We also have a unique partnership with our MCO, where we have a team of care coordinators embedded in our schools that I help co-supervise to help us engage in access and services, but also sets up a link with crisis care in our hospitals and emergency rooms. In addition to that, I'm also the current chair of the state's Social Services Commission.
My name is Rachel Gliniak. I'm here representing the North Carolina School Psychology Association as the North Piedmont Regional Representative, which encompasses 27 different counties. I'm here just to advocate and support the needs of the kids and making sure that psychologists are able to play a comprehensive role from early prevention and identification all the way through to after a crisis happens, being able to do postvention.
Hey, Jim Denny. I'm in the psych department at Appalachian State University. School psych trainer specifically. I probably have trained way over half of the workforce in North Carolina in psychology. So I've been there for, like, with my aging hair, over 40 years. I'm also, we have 5 training programs in North Carolina. So I'm the council chair of the 5 training programs. I'm also the immediate past president of the North Carolina School Psychology Association with Rachel and I sit on the board. I've come from the ground up. I have been a teacher. I have been a practitioner, and I'm also a former school board member who was chair for 4 years and vice chair for 4 years. So I think I'm well grounded, in the issues. I've worked in schools for a long time. I've worked with kids. I'm a crisis trainer. So as far as the bucket list, I obviously do mental health stuff. I teach mental health stuff. But I also do a lot of work in crisis training with school safety. And I spent a lot of time as a result of that talking about school climate, school culture. So that's kind of where I'm at. and I'm excited to be here. Honestly, I think this is like a dream come true where we finally get to a point where we can make some recommendations to really help kids in our schools. And I know we're all here to do the same thing, put supports in place so that we can do a better job in North Carolina for the kids that we're all here to represent.
Wow. I have to follow that. What expertise. My name is Lyndalyn Cacadelis, and I am a former elementary school teacher and also school board member. I currently am a consultant with NC Education Strategies, with my main client being a homegrown charter school education management organization. So I work with charter schools. I also serve with Stephen on the Charter School Advisory Board. And with that, I'm a mom and a grandmother too. More important than my grandkids. But anyway, glad to be here and glad that we are talking about this. My main concern, I think, is to make sure that we have what we need in the schools and help our, the grassroots folks, the teachers that are in the classroom, and not put more burdens on them, but help to remove burdens from them. I guess I would be school culture, even though while serving on the Mecklenburg School Board, I worked a lot with alternative schools, and so that was kind of my interest. So anyway, I'm glad to be here and to learn from you guys and be able to be at the table.
Good morning, and thank you for inviting us to be here today. I'm Ashley Perkinson with Perkinson Law Firm, here primarily in regard to my work with NC Child and our support and work on House Bill 285, the Suicide Prevention and Awareness bill that passed the House last session, and also very much supportive of additional efforts to fund school nurses and other important mental health providers in our schools. So I think I would probably be in the mental health and possibly school culture bucket.
I'm Kim Martin. I'm the executive director of this North Carolina Center for Safer Schools that we started 5 years ago. And I started this center with Billy Lassiter, who was with the former Center Against School Violence back in the day, and that was defunded at some point, and then fortunately was able to work with him to carry on some of that work with the current school safety issues. And so here we are today. And some of our new challenges that I've been given just recently is coming up with threat assessment teams for schools in addressing the students who are making threats against the school, as we saw in Florida and as we've seen an uptick in the state just over these most recent 8 weeks. so I'm kind of charged with that process right now, as well as charged with coming up with an assessment of the physical structure of school buildings and the grounds around the school buildings. So two totally different things, but assessments nonetheless. And work closely with our advisory group, the Task Force for Safer Schools, many of whom are here at the table today, and I will be turning to you all for help with the threat assessment team process as well as the physical safety assessment process. And I probably fall into school safety, even though on a given day I think school safety is mental health, another day school climate, another day the physical structure, but all leading back to school safety.
And I am Erica Berry, Senior Policy Advisor for the Office of Superintendent, and I'm really excited all of you were able to get here today. I know we have one missing, she's stuck in traffic, but what an all-star group. This is really exciting. And I also really appreciate your ability to hold yourselves from using acronyms. It's helping me, just returning to North Carolina, and a lot of times people use acronyms and I don't, like Caroline said, I don't know what's happening. So I really appreciate this, and I think it's important when we talk about serving kids and families. A lot of times they don't know what we're saying when we use acronyms, so it's important to adopt that practice of getting a little more specific with what we're saying, but not to be hypocritical. When I write all of this on the paper, I am using acronyms. Okay, so
Ease and convenience.
call myself out.
You just broke your own rule.
I know,
Yes,
but I didn't want to write it out.
Yes.
I'm being lazy,
All right,
but
fair
so I appreciate that. And like Caroline said, I really, the big goal here will be to equip schools with enough knowledge to make decisions around what they need to do to make sure that their teachers and educators are prepared to serve kids, especially those who are showing signs of mental illness. So, yeah, you.
Yep. Thank you all for agreeing to serve on this. I'm sorry that I came in late and missed the self-introductions, but while I might not have met all of you in person, I definitely know who each and every one of you are, because we have very specifically reached out across very different sectors to bring experts to this table so that we have a conversation that can actually lead to actionable plans where we can really start to move the needle on the mental health issues. So we're really grateful for all of you for agreeing to serve in this capacity. And I'm grateful for y'all's leadership. Thank you both for stepping up in this. And I know we'll set the big goals, we'll set the ground rules for conversations, because I also expect that y'all will probably have some difficult conversations. I mean, there is a true push and pull over what we know we need to address mental health issues versus what we have in resources and time on the school level, and those are recommendations that we can have come from this this committee if we say we need these resources as well to go to the schools for some of these things, but we're also trying to look at the landscape now. What are some things we can do right now to start addressing mental health issues? And I think we know this started years ago thanks to Bill's work. Thank you for your dedication to this. And it has, again, reared its ugly head in the tragedy in February. And I think one of the things that struck me most about the tragedy in February, and I shared this with Kim, and I met with the Center for Safer Schools right after we actually had a shooting at a school in Kentucky. And I think the shooting in Florida, it was so horrible that people reacted to it in such fear and in such a tragedy. We're also just upset by it. And then we kind of took a step back and said, well, wait a minute, it just happened a month ago in Kentucky, and in Kentucky 2 children died, but there wasn't, it was just another week, and it was talked about in the news, and we moved on. And it kind of, for me especially, I sat in my office and we canceled every other meeting we had that week, and we started to hone in on what we're going to do about this. It was kind of the realization of, man, we just lost 2 students in Kentucky to something that had to do with mental health issues, and a school shooting, and we moved on pretty quickly from that. And here we have another really horrible tragedy, and it started just feeling like, is this really starting to happen once a month or once every other month? And what major steps are we going to take to finally start to address, to own that for some reason in our society now, when we have a student with mental health issues, they feel one route is to go to a school and shoot it up, or to go to a movie theater, or to go to a public place. If that's the reality we live in, what are we going to do to proactively try to stop that from happening? And then also, what are we going to do to, if heaven forbid that student starts going down that path, to try to prevent it on the school grounds? So those are some very big questions that we now feel is a top priority here in the department to figure out, and truly appreciate each and every one of you donating your time and energy to this effort, and want you to know that what you come up with here, we're going to take very seriously and be prepared to move on. So again, thank you very much for the time that you're donating to this cause, and I look forward to hearing about the discussions. And I know we're on a tight deadline for some things, but I think you will explain or have explained, while we have that tight deadline, this also is going to be a working group that continues, because this is an issue that is bigger than just one report. So we're really excited to have you here, and thank you all so much. Thank you for your leadership on this. I do wish I could stay for some of this, but I have other things to have to go take care of. But again, thank you, and don't hesitate. Some of y'all don't. Y'all email me, and I do. I check emails, and it might be a few weeks after you email me, but I do get to them, and I really do appreciate it. So if anything comes up, please don't hesitate to reach out to me as well. Thank y'all. Thank y'all very much.
One last thing. When is
Yes.
the Krispy Kreme race?
February. But
in next February?
Yeah, I get to train for it.
Oh,
So-
okay. Okay.
Is there going to be a Krispy Kreme here in Raleigh?
There is. They signed a lease. So they sold the land, but then they signed a lease back for 20 years, I think.
Excellent.
I was hoping I could get out of the race that way. For those of you who don't know, I challenged teachers to complete the teacher working condition survey, and said if they hit a certain number that I'd run the Krispy Kreme challenge, which is a 5-mile run and eating a dozen donuts, which is a terrible idea. And it motivated a lot of teachers to complete the survey, to the idea of me having to do this. We did not hit the goal that I set, so I agreed that I would run, but how many donuts I eat is still up in the air. Maybe just one. Maybe we can...
You can do it if you believe.
Mr. Super, you can't eat just one.
No.
So, I can't get out of there with less than 3.
2. Yeah, but when you're running 2.5 miles,
oh gosh,
I've heard some people leave the donuts on the ground.
Uh-huh.
So it got attention, which is what I wanted. It got attention for the teacher working condition survey, which is something we'll have results for in a few weeks, and can actually be something that we bring here and can be another part of this conversation. So thank you all very much for this. I really look forward to hearing what you all come up with. Thank you. Thank you all for your service. Thanks.
Okay, so someone snuck in the back, so I don't know if you want to tell who you are and what agency you work for, but I noticed. Okay.
Hey, Jason.
All right, so we've gone around now and talked a little about what we do and the agencies we work for and the good things that are happening. And I do want to hear Mr. Pledger a little while later. You said something interesting about already kind of having that support system embedded in the school with a direct link to the crisis management team. So let's hear about that later. That caught my attention. But so are there other agencies or other things that you've witnessed in other schools or heard about in other, LEAs or out there that we are currently not doing, or you haven't currently heard anyone at this in this working group mention that could maybe go into one of these 3 buckets?
And I'll give an example. I got an email yesterday from the Public School Forum about their work with resiliency. So I think it's the NC Resiliency Project. I'll get it right. But that's something. So that's something that's really important and really great work going on that we can learn from. But they're not sitting at this table. So feel free to use the next few minutes to tell us what we left off.
Well, I think one of the things that we have been working over time, specifically with youth and youth leadership, and bringing youth voices to the table, as well as family voices and family leadership, and youth and families who have lived experience, who can speak to the challenge of stigma, the challenge of daily life as a student, as a family interfacing with educational services and related services, and certainly have served on the school safety task force, school mental health initiative, obviously our PTAs. I was, administrator of our PTA locally. Those are just really important voices at the table and voices in our school. They can make a difference. Students have a lot to contribute for lessons learned and things that we can implement. And one of those actually relates to compassionate schools and building resiliency among our student body, our school personnel, our school community and campus, and our communities at large.
Mr. Pledger.
Just to piggyback on that, one of the things we're doing in Wake County is in the beginning stages of implementing a community resiliency model, which is a model that impacts both the school community, school staff, and children. And so we're now at the stage of beginning to have staff trained as trainers for that. But our goal long term is to be able to implement that school by school to develop those. So that fits real well with that piece.
Is that so? It's a community, so it's like an outreach, teaching parents how to have more of the outreach, or
no, this occurs in the school. It is based on neuroscience in terms of how we respond to trauma.
Okay.
But it really is reflected by how we respond to any difficult stressor, so that it helps you to teach children to understand and staff to understand the causes and how trauma impacts our behavior and our responses as opposed to choice. Gives them an opportunity to do repetitive skill development, which brain science says then gives the brain the opportunity to rewire those connections. It also are skills that the staff themselves, whether in duress in their personal life or at school, to have skills that can help them to, when they're feeling dysregulated, to regulate. So it's all based there in the school. Now it can be, in terms of how we're doing it, it can be utilized with families. It is highly utilized with police departments, first responders. It's a model developed out of worldwide responses to trauma. It's a group called the Trauma Resource Institute in California that has developed it and trains that. But that's something we're very excited about.
Thank you. That's one thing that I wanted to mention was, and we had talked about it this week, and probably about almost a year ago now, we had mentioned at the Center for Safer Schools, we actually had someone talk about the Watchdog Association, but that's Watchdogs is DADS, it's acronym, DADS of Great Students. And essentially it could be any organization that comes in to foster parent visibility within the schools. Because a lot of times it's parents, you stop here, kids will take you, and we're going to keep you in this 8 hour, this building for 8 hours, and then you're going to go back home to whatever you came from. And so this is a community engagement where, all hands on deck, and it fosters parent visibility within the buildings at all times, which is so great for kids that need that extra advocate and that extra layer of advocacy in the schools, and also eyes for safety. If you've got parents, level 2, level 3, parent volunteers walking to school all the time, they're going to see something amiss probably. So I think that it changes the culture of the school to have that, but I think parents being in the school is a huge, huge thing that I think we need to see more of. But it's a culture shift.
I had two thoughts. One is I don't know if there's bullying programs in schools or so that might be something to consider, because obviously that's a key place. The other thing is the National Alliance on Mental Illness, NAMI. They have several programs that I couldn't speak to, but I know one of them is In Our Own Voice, and it's targeted towards individuals with, mental health or substance abuse issues telling their story. But I know they're looking at starting a younger person's group. So that's something that might be interesting.
Is that a program, or is that people coming into the schools and talking with those children?
So right now, In Our Own Voice, for example, members will come to the hospital, they do a PowerPoint presentation, talk to the patients, and essentially say, I've been where you have, you can come out of this. But they're trying to model it for a younger population. So the kids wouldn't be under 18, but they'd be much younger than the current population doing it.
Is that an evidence-based sort of, showing that I've been there where you've been? Is there evidence to show that's very effective?
I don't know a lot about the research behind it. I just know that, our patients enjoy saying that, oh, you were here and look at you now, kind of thing.
Mm-hmm.
And it does follow a program, so I'm sure there is some evidence-based behind it.
That's great.
It's related to peer support. Peer support has a great deal of evidence behind it. And Parents as Teachers as Allies is actually a school-based NAMI program. Very engages parents as students with lived experience who are currently in the school, as well as school personnel, to be a part of a panel and provide information, as well as to have dialogue about safety, climate, student success, and ways to engage with peers and reduce stigma.
A couple things I want to add. First of all, I think if we're going to get anywhere, I think all the expertise that we have in the room, we're really going to have to work as a team and collaborate. Because we can all be, which I think a lot of people focus on, and we can stay in our own little silos and we can work singularly because we're all here representing different agencies and different groups, right? But the reality is, this is not a new problem. I mean, I have probably been on at least 6 or 7 task forces on mental health. When you get down to the ground, the real issue is it's not any single program that any of us are doing, because we've all got programs going. The issue is we don't have enough resources in any of these areas to actually do it adequately without kids dropping through the cracks. Okay? So as far as I'm concerned, one of the things that we need to start building in our schools, is staffing ratios that make some sense, in all of our support areas. Because lots of us in this room do. Like, I teach threat assessment all the time. I teach suicide assessment. There's a number of people here that do that. And if you look at the work that we've done with the school-based mental health initiative, I mean, I don't know how you can look at the environmental scan that we've done in this state and look at where we rank in this state, like 36th, and we're above the national average, in incidents. But yet, if I look at my field in school psychology, and it's no different for teachers or anybody else, starting salary is $43,000. And the mean national salary, for somebody is 63. It takes somebody 25 years in North Carolina to get to that salary level. So if we're going to recruit professionals in our schools, we're going to have to, I think, make recommendations to deal with staffing ratios in all of our areas. We're going to have to support teachers. We're going to have to support, lots of things in there, but we're going to also have to increase morale by increasing salaries. And then I think if all of us, you know, are working as a team, which is really what all of us should be doing anyway, because we're all here representing the same group. That group of the children in North Carolina. That's what we're all committed to. So I would challenge you to like look at the recommendations that we have here, and let's just however long we work, however we like get through these issues. I hope we'll continue to work as a team. I hope we'll keep our eye on the big picture. And I hope in the end, we'll make some recommendations that honestly will get some more troops, you know, on the ground. Some more, you know, that's what it's going to take, because unless we do that, like, if you've got 1 in 5 kids in North Carolina, and some of you have heard me break it down by classroom, by school, there are going to be kids that drop through. And I think everybody in this room would be the first to say that if we lose 1 child from a suicide, you know, or a shooting, it has the same impact on that family in school, you know, if we lose 10. So every single life is important. And, you know, we rank second in suicides. And so that's a huge, in my area, you know, it's one of the highest, you know, represented, you know, areas where we have all in the western part of the state, overrepresented in the number of suicides. So that's an issue. And I'm all about trauma-free, you know, schools. I'm own county work on that. So, yeah, that's what I think we need. I don't think we need more experts. I think just we need more resources.
Thank you, Dr. Denny. Appreciate that. So I want to move on to the trainings that have been considered up to date, and we were gonna have 3 people talk a little bit more about those. Bill, Ashley, and Stephen. If Bill would like to go first.
Sure. Well, I'm not sure about trainings as much as just organizational structure.
Sure.
And I'm not going to go through the policy, but basically what's happened with the School Mental Health Initiative in the last year, as we've been waiting for this meeting and the culmination of what the decisions are going to be, we've continued to meet, and this point on our list there are over 400 people who have, most of them at some point in time, come in and out of this meeting. We have a core group of about 45 or 50 people who show up at each and every time. I just want to give some background to that because I said we're staff. DPI basically, about 3 years ago, I guess, pulled together and realized that we had multiple sets of people looking at school mental health and mental health issues in general. And we kind of got together and said, something needs to happen. We need to make sure we're not competing with one another. And so we kind of came together and laid it out there and pulled together a group of folks who now are the School Mental Health Initiative. And they pretty much, we did, as Jim said, we did I think about 2,700 people survey. We got a survey of about 2,700 recipients or responders. We also did focus groups across the state, and it was that group of people and the energy and the effort brought together the white paper and some of the things that you read over this past week, and then the policy itself came forward. As any time with a policy like that and with that many people and with that much interest, it was a great big policy when it hit the state board the first time. And it had everybody's interest in there. We we had to come back and do some reduction on that policy, and actually the School Board Association, Kathy Boyd, who's mentioned in here, helped us a lot in trimming down the policy itself and getting it into the condition that it is now. But in this past year, as we've been kind of waiting for the next iteration, we have been, we got a technical assistance grant. And in that technical assistance grant, there's a shape, it's a process, basically. It's a needs assessment that school districts can use. We have 17 districts across the state who basically entered into an agreement with us to do that. And really, there's no money engaged in this at all because it was technical assistance, and it came out of the school mental health group there at the University of Maryland. And we've been working in concert with them since that point in time. These 17 districts have basically done their own needs assessment and begun to organize their planning. The School Mental Health Initiative has basically broken into 4 groups: continuum, communication and visibility, professional development, and research and evaluation. We've regionalized because we've got these 17 districts across the state. These 17 districts across the state and the 8 regions, and we've regionalized them. They're now formed in teams working together out there in their region to build support around what they're doing in their districts. The 4 groups that I just mentioned are actually looking at what's in the policy and breaking it down by those areas and developing support to basically get out to the regional teams to help support those SHAPE sites in their planning. Those groups also are basically looking forward to moving with policy in the coming year because it's based on what's in the legislation. This coming year would be the planning year for all the districts to move forward. So developing what those planning items would be and the structures around planning for each of those 4 areas to make sure that we can get those in place and ready to go. We are also part in this process with CNI and with Alan and Christy to look at another grant. This one has some money. So Project AWARE, which is Advancing Wellness and Resiliency in Education. Its primary goals are to increase awareness of mental health issues among school-aged youth, so working with youth in the schools. Providing training for school personnel and other adults who interact with school-aged youth to detect and respond to mental health issues and connect school-aged youth who may have behavioral health issues or serious mental health or serious mental illness in their families to needed services, which fits very closely with the 3 elements of the policy itself. It's a $1.8 million a year for 5-year grant. We do feel very comfortable that we're seated well in what we've got in place with the SHAPE and what we've got in place with the policy. And we're going to be moving forward with that, trying to secure that grant as within an interdivisional work here inside the department. And this is for state educational agencies, that grant is. But obviously we would look at how we could use that money and some of that to disseminate down. One other thing, and I know some people have heard me talk about this for a long time, but we seem to be on the cusp of working with DMA to also look at Medicaid dollars. There is a free care concept out there that allows for services to be billed through Medicaid in the schools that we've never been able to bill before. And we've got, we're in regular discussions now with the head of DMA and also some legislative folks where we, I think, are finally, as I said, on the downhill side of that and being able to secure that. So there will be funds that actually could be utilized in the future to cost shift to be able to help support social workers, counselors, psychologists in the schools as those funds grow. so again, there are lots of things that we're doing that are centered around this group and moving forward. There are the professional development of professional learning group out of the school mental health piece is looking at and would look at the different types of trainings that would be available, trying to create a menu of trainings. Because, like Jim said, a program is a program, but we don't know that that program fits everyone's needs and works with a particular district. What we're doing through the SHAPE grant is allowing districts to begin to understand how to look at their own resources and what they don't have inside a district and begin to build that forward. And I think, you know, the things that we're talking about here, the planning, we're working closely with Susan and folks in mental health to look at what they're going to present, and we want to be able to have something structurally in place that allows them to create a menu, work from that, and begin to organize what they need from a planning focus in every district.
And within every district, each school would have the ability to, because my school would have different needs than a school in my district 8 miles down the road has completely different needs than my own school does. Same district, but yeah.
And I did just, I have good friends in Florida, and obviously, sadly, I was here when Columbine occurred and was actively working then in the same field, and now with the Florida situation. But they actually have called us about our policy because of what our policy provides in the way of infrastructure and support, to look at what they could do to adapt elements of our policy for what they're going to be doing in Florida as a result of Parkland. So, there, you know, again, I think we have the basis to move forward. As Superintendent Johnson said, push and the pull is there. The real push or pull, whichever way you want to look at it, is how do we help support this in funding? And so we're looking at as many different things as we can, because we recognize that as an issue. But it can't be an impediment.
Sure.
We've got to have a planning model, and then we've got to figure out then how we support that as we move forward.
I have 2 questions.
Sure.
1, tell me more about SHAPE. And then 2, when you talk about the menu of options, what are you going to consider in this menu? So like, not just saying here's a training, but like, are y'all going to put more information about the training, how much it costs, time, all that good stuff?
Right, and if you look at this, the training is to be offered to the school districts for free. So it is going to be our responsibility as a department to support the development of that, and also the integration of multiple other systems out there, such as mental health folks, such as other organizational structures that we could pull together as a cooperative to do these kinds of things. Well, there's obviously suicide prevention training that needs to happen. There's a whole array of trauma-based trainings that we would need to be aware of. There are specific things that are relative to certain types of practice, cognitive behavioral therapies. Just awareness, of the various trainings that are out there. What we would do, and what we're basically saying we would do, is do the research behind what's available, what is evidence-based practice, how do we make sure that we've got good things available, and then moving that forward. Okay. So that's, and we kind of reorganized ourselves inside our division. Our behavioral people, we moved to the integrated academic and behavioral section for PBIS and other sports outside. We're moving state dollars that we used to have inside our division, which are the old William monies, to that group to begin to do other things outside. We're also then looking at redoing our federal monies inside the support structures, and we also put SHAPE, which they're quality indicators. Primarily, that's what SHAPE is. It's a tool to go look at the quality indicators that you should have in place to be able to have successful cross-agency support and integration. And you basically identify what your capacity is, and then what what the needs are that you don't have, and then how you build that forward. We actually have now put that in our funding policy inside our division. So in the world of special education, if you're going to get money to support behavioral needs inside a district, you have to have a cross-agency, cross-ed. So it's not just special ed, it's got to be regular ed. So cross-ed and cross-agency support. And so we're requiring that they use the SHAPE and the quality indicators in SHAPE to be able to apply for those dollars. So,
No, you
I don't know if I answered all your
Yeah,
questions.
no, that was perfect.
So one thing I would add to what Bill said, you know, another way to look at SHAPE is like doing your own self-assessment. And then as a result of that, looking at your service gaps, and then doing resource mapping internally to look at your support personnel, you know, and providers in your community, so that you address those service gaps, you know, both with internal supports and community supports. So that's why it's going to look different in every community, because your community resources are going to look different. Your internal supports with your student support staff are going to look different. So you might be strong in one area, but you might see service gaps in another area. Like, I mean, people don't really think about it, but transportation is a huge service gap. So, you know, it could be that you have families that, you know, have to get to A to B, you know, for services, but they don't have transportation. So it's another way to look at SHAPE, and as a result of SHAPE, you're also using evidence-based practices. That's a requirement, and you're collecting data, you know, along the way. And so, you know, I've been involved in the research and evaluation component of that, and so we hope we'll look at all that data over time, and that we hope SHAPE will expand. But we've got like people right now in 8 regions, and we've got coordinators in each region, and we're beginning to scale that up, and provide supports, and as that expands, then we hope to have people in all 4 of those like big groups, those big buckets in all of our areas, so that we're like building from the ground level up and using all of our resources in our communities, you know, as well as in our schools. And then the training for teachers and other staff is a really critical piece.
And I just want to emphasize again, we help support them, but it really is people from across the state. We got them from all the way from the east to the, you know, to the west, who come together with an interest in trying to ensure that, as Jim says, we're going to have kids fall through cracks, but that we narrow the cracks to the place that we have fewer and fewer kids falling. And I think, you know, it's their energy. So we had a parent that was presented to the board when we put the policy forward, who basically had to travel 50 miles one way to get her child treatment. Wow. And, you know, it's just trying to find, and that's what we're looking at in trying to identify how an area needs certain levels of resource that other areas don't. And how do we do that? What do we do, and how do we do that together, not schools in a silo, not agencies in a silo, but together to make sure those things, that people don't have to go through that hardship, because that is going to basically lessen the opportunity for that child to get services.
Great.
One of the things that was compelling about one of the first meetings we had with the school-based mental health initiative was a comment that Bill made that stuck in my brain, and it's still there. When you think of exceptional children, you think of parents advocating for more special ed resources, right? But what they were actually advocating for was more mental health supports in schools. And to me, it's astonishing that you would have EC parents, you know, requesting more mental health as opposed to more like special ed supports. So I think what that does and what it shows me is how it resonates for parents. And that came through in our focus groups. And if any of you saw my PowerPoint I presented with the graphs, I mean, parents were pleading for more resources in school. And that's where I think it hits home for all of us. And because it's their children in the schools.
And I think that hits on the fact that the reason why we're all here today is we want children in school to have the academics. We want to be them to learn as much as they possibly can. But if you don't have that basic mental health ability and they're not doing well with that, you're not going to ever get to the bottom tier of the academics. So that has to be in place before anything else can be in place. So the reason those parents advocate for that is that their motives are pure. They realize that one has to come before the other.
I think one thing that we do need to say, because I think some people are confused, like I got some follow-up questions from legislators. You know, this is a school-based committee. You know, we are, some of us, DPI, and we're looking, and everybody agrees, you know, school support staff need to be increased, enhanced. I think that everybody agrees with that, but to say that we're never going to need, you know, the outside LMB, MCO providers for follow-up care, you know, for care with our kids who need more services, who may be sicker than others, and that we're not going to need juvenile justice, for example, to do their support services to support the students in school. So I just want to, you know, clearly this is a school-based committee. We're talking about within schools, but we also need to pay attention to the outside support and the other agencies that we're still going to need. Because sadly, you know, not one school can do it all themselves, even if you know, double the support staff. So.
And then just to follow up that, Senator Behringer, when we were over in a legislative oversight committee for developmental disabilities, actually, but in that meeting, the whole issue that you're just talking about, the lack of coordination and communication and difficulty of making sure that we've got truly integrated and collaborative work came up, and she committed to that day out loud, which I love to hear someone say something out loud in a public meeting that's being recorded, that a children's cabinet would be the evolution or progression of what now is going to be inside the DSS transformation. Its evolution was going to lead to that children's cabinet, because that is a huge piece of trying to make sure that we've got coherent and cohesive policy around kids, and all the agencies playing together to ensure that we've got that support. And it's been an issue, actually came from Billy Lasser in the School Mental Health Task Force under McCrory, the governor's task force. And it's stayed out there alive and floating for a while, and now it appears that it's got some wings under it. And she, as I said, made that verbal commitment in that meeting to ensure that that would be a progression of that group.
So do you see that being the cabinet that's just kind of the checks and balances and make sure that things are done within the school? Do you see that as people that are already within the school, or do you see that as different people that come in to make sure that things are being done at district level at the school?
Well, what that would do would be able to break down the barriers that would occur through legislation, that would occur through various agencies, what they're required to do. So I've got federal requirements in my world after Wazoo. Making sure that as we plan to do things, that those things don't get in the way of one another, that there's congruence. There's forethought about funding and policy and implication of change of policy. What is that going to do? And that's really what that conversation has been about. And like I said, it's been a huge piece. Billy pushed it from the beginning. There's a group, interagency group, that meets fairly regularly that includes all the elements of DHHS, juvenile justice, education.
Foster care system.
Yeah, and that's been an element of what we wanted to see move forward. So there have been several larger meetings about it, and Senator Behringer decided that her forum, because it's already a interagency group to start with, would be the opportunity to move that forward. And again, I'm only going to say what she said out loud, and she said that that would happen, and that we would move forward with that as a process.
Thank you.
I couldn't agree more with what Kim is saying either. I mean, I think we obviously need, that's what I mean by collaboration and teamwork. I think if you look at every bit of literature, it all talks about the fragmentation we have, in schools, and schools are like full of silos. So if we're going to solve this problem, we really have to collaborate. We have to appreciate all the skill sets that everybody brings to the table. And we have to work with our individual community partners, as well as our schools, and our parents in those communities, and put in a teaming structure that will allow us to provide, a full continuum of services. And my theme is always going to be prevention and early intervention, because there's not, like, the research is compelling from here to the ceiling. If you're going to really solve problems with children, you got to start early, and you have to put prevention programs in place that, if you're reactive in high school, it's you're working against yourself. But if you're proactive, you can really have a tremendous influence on young children, and you can really make a difference. So I couldn't agree more with what Bill's saying. What Kim's saying is we definitely need all the agencies, all the partners working together, and let us not forget the massive number of substance abuse issues in schools as well. So that's part of the continuum, as well as the social learning, piece of it.
Thank you. Ashley Perkinson now, if you could give us an update on the youth suicide awareness and prevention, please.
Great, thank you so much. And I'd love to talk about the background of the bill and also its substance. So House Bill 285 was introduced in the last session of the General Assembly. The sponsors were Representative Murphy, Representative Hardister, Representative Dollar, and Representative Dobson. There was also a companion bill in the Senate, Senate Bill 316, that was introduced by Senator Krovic, Senator Pate, and Senator Davis. Now the House Bill 285, passed the House pretty much overwhelmingly. It was 109 to 7. It was also added as a provision to the House budget, but didn't survive through the Senate budget. And then also we were able to get it attached to one of Representative Horn's bills. So a lot of interest, a lot of champions at the legislature. Now the genesis of the bill really came from Representative Hardister. He had a passion and an interest in developing a suicide prevention training for schools. And NC Child, we learned of that, and we approached him to see if we could work together. And the substance of the bill really comes from recommendations and best practices from the Child Fatality Task Force. And I know, Susan, you're on the task force and can speak to the in-depth research and how they came up with those specific recommendations. We know that there's a need for suicide prevention training. We know a lot of states, I know at least 19 states have passed suicide prevention training bills, and in part in relation to the sharp increase that we've seen, not only in suicidal thoughts and writings, but of suicides. And you all are familiar with the sharp increase. You've seen it in the reading materials that we had in preparation for this meeting. Also wanted to point out a couple of quick statistics, and this really is very startling. According to the 2015 North Carolina Youth Risk Behavior Survey, this is self-reporting, but 9.3% of North Carolina high school students had actually attempted suicide, not thought about suicide, attempted suicide. And in 2014, in just 1 year, there were over 1,600 emergency department visits and 513 hospitalizations for self-inflicted injuries among youths. You probably all heard the saying that suicide is a permanent solution for a temporary problem, and you know, the sad part about that is most of suicides can be prevented, and that's why suicide prevention training is so important, because we can prevent these suicides. I mentioned I'll walk through some of the aspects of the bill, and we've got some of that information on our materials as well. But what the bill provides is for the State Board of Education and the Department of Health and Human Services, Division of Public Health, to develop a youth suicide awareness and prevention training program and model risk referral protocol for public school units to provide to school personnel to directly work with students in grades 6 through 12. Now, the list of school personnel is spelled out in the bill, so you can see that list. And I know that was attached as part of your reading materials. We originally had the training to go through some of the elementary school grades through 12th grade, but we changed that along the way for it to be 6th through 12th grade. And for that training to take place once every other year. The bill also sets out that if the individual school district does not want to do the free 2-hour training that would be developed, that they could also develop their own local training as long as it met certain criteria that was spelled out in the bill. We also made or put into the bill that if the bill passed and the training was in place, that it would complement any broader mental health training that would be required by the state, because we heard the concerns from some of the groups that we want to respect the time of our school personnel and district leaders, and make sure there's not overlapping or duplicative trainings. So we want to make sure in moving this training forward that it complements any broader training that may be required. So we wanted to make sure that was in the bill. We also included in the bill limited liability language for local school districts, because that was an important aspect. We want to make sure that we're not creating any additional potential liability for school districts. So we made a few changes, and I've mentioned most of those throughout to make sure to be sensitive to those concerns and needs. But at the end of the day, would really love to see this training move forward. And I mentioned earlier, to be in the mental health bucket, but we all know the interconnection between mental health and school safety, and even though we know the vast majority of individuals who are suicidal would never hurt anyone other than themselves, there are some, as we saw in Columbine and Sandy Hook, that were suicidal individuals, and so it is very much connected, very much needed, and we look forward to working with the stakeholders to hopefully put forward and make sure our school personnel is getting that suicide prevention training at least every other year. Another, I will mention another change that was made from the original bill. The recommendation from the Child Fatality Task Force was to have the training every year. And in sensitivity again to the demands on school personnel, we agreed to make that change from every year, even though best practice would say every year, to every other year. And Susan, did I miss anything? Did you want to add on?
Well, and you said mental health, and you said school safety, but the culture of the school too is the stigma with mental health.
Absolutely.
And so the day that we win at this would be to where students feel comfortable telling someone, and then we've really done our job then, of when they feel comfortable enough in that school culture that they can actually reach out,
right,
and get help, necessary help. Yes, sir.
We've actually, in our training that we do with students, one of the benefits we've seen is a significant increase in peer support and peer reporting. And so it certainly has shown that to be extremely beneficial as they've, gotten that training and had that exposure.
That's great. Yes, ma'am.
I just want to piggyback on what you said about that culture. The conversation that Erica and I had previously was just about how we talk about it. So the emphasis might have been, some school violence and school shootings that have taken place that also to be around this table and others talking about mental health and substance use needs. But I think if, as leaders and as people who are setting the stage to reduce stigma and increase the culture of awareness and people feeling comfortable coming forward, we really have to be careful about how we link those two things. As we said here, and as we know, people with disabilities are more likely to be victims of crime versus perpetrators of crime. And so as we continue to talk around this table, I think it's very important to lead by example and not link school violence and school shootings to mental health issues, but said we're here for the total well-being of students. And as we increase that total well-being, we know it will increase the positive culture at schools and the academic outcome of students. So just to lead by example as we continue to have this conversation, how we talk, how we prepare policy, and whatever our recommendations will be, similar to not using acronyms. I just kind of wanted to point that out as we, think about the work that we're doing.
Absolutely. Thank you for that.
Yeah, I really appreciate the Child Fatality Task Force and what you guys do and the report you put out, which is fantastic. The 2015, because that's the latest data that was in the 2017 report, talked about, of course, the 35 suicides that happened, the teen suicides that happened, 35. And we don't want one.
Mm-hmm.
I mean, we don't want one. We have 1.5 million kids in school systems. So I would like to know, was there ever any data collection on what interventions were being used by the 35? I know one of the 35. What interventions were being used? What were not, was anybody not knowing this?
That's a great question.
So that we can see maybe what gaps were there.
Mm-hmm.
Do you have that? I don't want names or anything like that, but just interventions and maybe regions of where it happened.
Well, first of all, 35 is one too many.
Right, I totally
agree with that.
Yes.
A part of the challenge is looking at critical mass of numbers and where suicides occur. And so often there are not a cluster, sometimes there are in some communities. So more to the point, kind of stepping back, what I wanted to be certain to say and follow what Drew mentioned and Rachel and Bill and Ashley, and that is that, and Kim, that we really engaged our community stakeholders. So we had families, we had community school representatives from some crisis teams, from student support, school nurses, who were a part of the conversation and the research that we did in coming to the recommendations for criteria and what's out there, what's possible in other states, and what's working in our state, what's working in our communities. And what would be possible, what would be flexible. So if there's something that's already in place and it's working in that community, Caroline, you had mentioned something works in one school, might not work in another. You may already have some protocol in place. Trying to make certain that that protocol and the criteria there could be some alignment, as we've been talking about, and then there would be some consistency. And what I want to encourage us to think about is that suicide deaths and suicide attempts are cumulative. So it's not one element, it's several, and it's over time. And we don't necessarily always know what that looks like. Oftentimes, though, what we have found is that there are indicators and that someone knew. And so, Drew, you had mentioned that youth have become a part of the solution, that peers, when they have been provided good skill training, and there are several curricula that are good for students in prevention and overall universal prevention. And it takes a multi-tier. It takes more than one of those prevention programs, whether it's counseling against, around access to lethal means and making sure that there's a safety plan, whether it's understanding that there's a 1-800 number that someone is always going to, 1-800-273-8255. If it's not in your phone, it should be for you or others, that someone is always going to answer that phone, or that there's a safe adult to go to for those students. And so it's really important for us to understand that it's multi-tier. And then also making certain that there's access to mental health treatment and really good or substance use treatment. So it's multi-pronged, more than one foot, that makes the difference over time. And that is what research has shown us, both in some of the grants that we've implemented here in North Carolina as a part of the national group through the Lee Smith grants. So multi-pronged peers are really, students are really a part of that solution. And some of the work that we've been doing, and you had mentioned it in terms of folks with lived experience coming and speaking about their lived experience and understanding what those signs and symptoms are, what that looks like, making it real, breaking it down, and also really communicating to students at large. You're not alone. There is hope. There is that next step. And we're more alike than we are different in terms of the opportunity to make a difference in the peer culture in the students' school environment and with schools. And some of the youth move work that we've been doing with parent and family voice and youth leadership, some of the panels that they've been doing about what harms and what helps, some really just open conversations so that school nurses, school social workers, school psychologists, and teachers alike get a chance to really ask questions of students who have lived experience with substance use or with serious mental illness, and what makes the difference for them.
And I understand suicide is always extremely complex, and it is like dropping a petal in a lake with multiple ripples. But I do think it's important that even the 35 that we know, were they enrolled in public schools?
I cannot speak to that immediately, but I would be happy to follow up.
I think that would be important to know.
I believe that most
question.
of them were.
But I mean,
I would be happy
I don't
to
know.
follow up.
And then if they were enrolled in the public schools, I just think it would be important to know, okay, were they seeing a counselor? Were they seeing the school psychologist? Were we at least trying to help those that we didn't catch?
And were the warning signs seen? Like at what point was?
Well, I actually think it's important also to think about the school nurse report, the annual school nurse report, because we have far more individuals in our state who attempt than who die by suicide. Right. And so it's thinking about what, and part to your question, I think, Madeline, and that is, what is it that's before, and then what's the intervention, and what are the supports, and are they known, are they accessed?
We know one thing, whatever those 35 were receiving, it didn't work. I mean, thank God that we are catching much more than make it to that where there's no more problems to solve. I mean, such a sad story.
Right. Well, and I don't know that we know that we're catching it. And I think that's the reason that training is so important, to be able to spot some of the warning signs, to step in, because, you know, again, with the tremendous increase that we're seeing in the statistics of suicide, it's just that much more important that personnel who are working directly with the children, that they're able to step in when those warning signs manifest themselves.
And, you know, Drew was talking about training that they do, and that's the Lifelines curriculum that really helps in a tiered approach with middle and high, and then a booster before students leave to go to college or vocational life after graduation. But there are also universal measures of providing gatekeeper training that really help identify the signs and symptoms and how to get help. That is really a part of the culture. That really is a part of that shift. Everyone has a role to play.
Well, and we're even seeing now with social media, screen addictions. I mean, you know, we're living in different times than we have in the past.
And when we talk about suicide prevention, I think, you know, we have to also think about the hospital. So a child is admitted to the hospital. It could be prevention because they didn't actually do something, but there may be self-injurious behavior or thoughts or actual attempts. But what we find as a huge challenge is when the child's leaving, when they go back to school, because many of them do, the school's not equipped to handle a child with, you know, such high issues or being so high risk. And so they really do potentially fall into a hole if they're not seeing outpatient providers for whatever reason, even though they get them when they leave. The school doesn't always feel equipped to handle those kids. And so they kind of put their hands up. And so figuring out how we can help support the school when these kids go back. So we know you're already, you know, at high risk. So, you know, it's a given. So figuring out how to help support them from further action.
And that's one of the tenets why we're here today is schools want to help, but we're saying how.
Yeah.
So, you know, so that's one of the purposes of being here. It's so important.
I think what's buried in Drew's comments is a plan. And the fact that Wake County has a plan, and it has a multifaceted plan. And it has the top end, what you do to connect those kids to the resources, the hospitals when you need them. You know, over time it's evolved to the point that you're looking at various aspects of it. I mean, I know within the general content standards, we're also in the healthy living and in the guidance pieces. Right. They're in our standards. There are things embedded already that's prevention, but it's all incorporated inside a plan. And I think, you know, that becomes the key issue. Do you have prevention? Do you have primary or basic intervention? Do you have that connection with the community to basically look at what needs to happen to make sure that you have those relationships with the hospitals, with the MCOs, with, you know, whomever, to ensure that, because you're not going to catch them all. But the more you plan and situations arise and you respond to that in the context of a plan, then you build layers of resources that become prevention support, intervention support, transitional planning back to the schools. You know, those things that they happen because people are, you know, with intent, look very carefully at what's going on, and I think that's a huge part of this. That's why the needs assessments are important, to understand resources, understand gaps, looking at those elements of it and how you build those things out. You know, they just become crucial to providing basic infrastructure that can be built to support a much deeper look at how you do it. And that's where the menus come up for trainings. I mean, you just, inside of a plan, you create opportunity, and that's the crucial part.
Ladies and gentlemen, this is a great conversation, and if you haven't got to speak yet, please write it down so you can remember it. We're going to take a short 10-ish minute break, but before we do, Michelle stepped in the room late. She was she was on the road.
In the car for a very long time.
In the car for a very, very long time today. So I was going to have her introduce herself, and then we'll have a short break, and then come back here.
Sure. So my apologies. I would ask you guys just to, take a moment to be grateful. There was a really horrific car accident. I left my house in Pittsburgh at 7:30 this morning, and I'm just arriving. So I always do that. I just take a moment to be grateful for my friends and family. So I've shared a similar space as this with many of you before, talking about youth in North Carolina. But my name is Michelle Garino. I'm a licensed clinical social worker. My background's pretty unique. Most of my career I have worked within law enforcement to work with youth that are gang involved and develop prevention, intervention, and diversion programs. I also have been a part of the crisis intervention unit with Chapel Hill Police Department, and currently still work on initiatives through Safer Schools. My hands are in a lot of pots, but they all have one thing in common, and that's the youth in North Carolina. And I also am a faculty member at NC State in the Department of Social Work. So I'm so glad to be here. I'm glad to be here finally this morning. And thank you all for being here. Appreciate it.
So let's take a short break, and if we could, we'll make it a little bit longer, till 10:50, so that everyone could use the facilities. And if you're back later than that, you'll need a late note, please.
And if you don't know, the bathrooms are behind the elevators. If you go that way and then walk around, you'll find the bathrooms. And I'm gonna run downstairs and get parking passes. How many can I just? If you want to show your hand, awesome. Okay, thanks. Okay.
I got the last spot in lot 1.
How are you doing?
Good. Yeah.
Doing good.
Adjunct faculty.
Name?
Rachel. I the stage for the just from looking at the physical arming everybody area, which is an important piece, but you have to have the other piece. Yeah. It's amazing how the pendulum swings back and forth. As it, at one point, it was anything, right, with these aspects, and now it's swinging the other way, but yet follow-up care, yet the expertise of other professionals. Still going to need. Yes. Who are they going to refer to?
Right.
Yeah, for the student.
Absolutely.
So, right this past Monday, there was a little confusion. Yes. And so, I think everybody here agrees, so that's good. It takes the wraparound services as well. Oh, no.
Those are always
Yeah. Yeah, wow.
I'm going to go get something to drink
Did you say?
downstairs. Does anybody want
What do I say?
Oh, wait.
Sacred Element.
I'm sorry to bother you. I'm in News 14. I'm just trying to get everybody's name so I can attribute the quotes to everybody, if you don't mind.
I'm Ann Nichols. Really like the era where
It's all the way down the end and making sure that everything. I try.
So.
Ladies, I'm sorry to interrupt. I'm with News 14 and everybody's name. Speaking of
Sure. Caroline. Well, I guess chair of this working committee.
Yeah.
But I am a teacher in Johnson. Walk in, I'm like, now I can't focus.
I'm sorry.
No, I was talking about your dress. I could focus with your cute dress.
All right. I'm Erica Berry, and I'm here behind.
Oh, and I see if this is this online somewhere.
Trying
To
to
look, but I was like,
I
see or a K.
Okay. And I'm not going to
Oh, my oldest, and she still has one
Thank you so
more year
much.
nursing.
So I was thinking probably a 1 o'clock-ish.
Our goal was before then.
Oh, before.
Yeah.
I like to give people worst case scenario.
Just
Only other questions, do you have a date for the next meeting?
So the report is going to be due May 31st. And so the actual next meeting, if it, I can't talk. The next meeting when we do meet, it is going to be really short, but we don't have a date. That's one of the things that I would want to table about.
Oh, yeah. Okay.
So yeah.
All right. Thank you so much.
Awesome. Thanks.
It just makes sense. It just would make sense to do this because you have so many industry and agencies here. This can be streamlined. Whatever in each district.
Right.
So that's nice.
Yeah, I know it's hard for mom though.
Yeah.
I get that.
Travelers is always, I mean, that you super as long as they travel, they know about it.
So exactly. So like sending an email to a district from this place
It's going to go to my spam.
yes,
Which is
too traumatizing.
Yes.
Usually I'll get and I love that professional growth. I had no
Leanne.
It's okay.
It's okay. I just correct when it happens, so. Oh, goody. I do have a question. Is there I have an Aunt Leslie, and a lot of people know her, so they know the precedent things. It's an ill name, and I'm Aunt Leslie, and it's okay. And then my sister.
It would just be a way to streamline things and make sure they would be the first. That's right.
Is she here? I'm not here. I mean, she's in the.
Yeah. Absolutely. And these are the people that say, it is now passed. Now let's do it. And I'm ensuring that I am putting my name on the line to ensure that my school is doing and I take responsibility.
So, I mean, how would you?
So, just a thought.
I'm a fan. I'm just gonna put this up. So we can add to it. Yep.
He was a HRSA scholar.
Yes.
So I
Yep.
had this HRSA scholars.
Oh yeah.
I know that.
I'll be right back.
Okay, yes, sure.
Watched them present quite a few.
Hey, I'm so glad you're here. I'm sorry. Ooh. Is it like one lane, or do they even have to just open up the shoulder? It's sad.
It's closed, so when I finally, so I was I mean, I'm still in Chatham County.
Oh no.
But things are connected.
That was,
And I know that the whole shut down. I know what's happening. And then I was texting you.
The county.
I'm like,
Oh, that's the
And so then I
worst.
started getting upset. Like, I have talked to everybody. Everybody knows where I'm at. And I'm like, someone's
Gosh, stop
right now.
it.
Yeah. And then my husband watched me. It's like, I know I'm not random.
Wow.
I don't know. Maybe
Oh, that's so
maybe I'm
great.
over
But you know, he just needed
I don't
that.
know.
Like, he needed to feel like a person at that point. I know.
I'm thinking, I'm just.
Of course, yeah.
Oh, don't run.
Oh my gosh, did you get gas? Were you okay? Okay, good. Yeah.
Because we went like 40 minutes around and finally got outside.
So is thought about it? You've been home.
I'm like, you know what? I just need to go home with babies and then come back.
Oh my gosh. Do you know how many cars?
And the thing was, you know, something
I had those years.
I heard on your
And I was in home having kids. This was Chief Justice shut down.
Oh, okay. Okay.
And he's over there doing the school justice partnership.
It was a new
Great.
Yeah.
It's just sad.
So I've come back to the state again.
Okay.
And I'm like,
Makes me want to like.
the regional and areas.
It's recorded. It makes me want to
Because
like those times where I drop it every day. Like I just want to
like, what is this?
Yeah.
My kids diet, my feet. Oh yeah. Yeah. Not that you need to hear all this, but
no.
you know, but that's something.
You got time this afternoon?
Yeah.
I mean,
Yeah.
yeah. I'm much later.
Oh my God. Well, I'm glad you're here.
Yeah, you're talking about
I was rough. I got the last spot in parking lot.
let me ask you a question.
Good.
The last one.
Oh, that's so perfect. Yeah.
She put the cone up. I'm like,
Oh, that's perfect.
my luck's
You're awesome. No, you're good. See, that means you're meant to be. There's no such thing as going to be after this break.
I've never been allowed to sit in big boys' days, so they had some
Yeah.
She sent us a
Yeah.
I had our Kim, Greta, and I didn't know Greta was going to be. Caroline.
Yeah. Yeah. No, you're
We all
awesome.
like
So many. Yes.
together.
That's why they
Still
asked if
trying
we needed
to-
like a
Yeah, you
PowerPoint
did.
presentation.
I
I
saw
was like,
the
no,
little
these people,
thing.
you be preaching to the choir. They don't need diagrams.
I seriously
They're creative. Like, yeah.
That
So,
would be,
um,
there's two places in this
okay. Yeah. So that was
where I die. One's Cornwall,
the only folks
that's
that
where my
were
family's originally
in
from.
you and Chiefs
And the other's the Holy
make it last.
A lot of places like the County Institute is really, would be disappointed if I never made it. It was really cool. And really, a lot of the people on that, you know, we're going to see inside.
At least I could do.
But I travel, that's always the case. But I always enjoy most is, I like seeing the sites, but that's kind of, you know, check stuff. Meeting the people and trying to, I gained like 8 pounds.
Okay, I'll let you know. Okay. Sorry.
I love it.
How are you?
And because I wrote it down like that.
I know, right?
Question
I
marks
know.
were on.
I was trying to finish the thing because I didn't remember back we had met before.
And what happened that may not have been engaged with this.
I know. I'm just reading your stuff.
But the numbers of students are engaged with. I'm sure they did do that. And I was just, I wanted to make sure that teacher aid was
So it's who's the school nurse on the school team.
That's the, it's not forever. Not many there were. It is strictly school nurse number of streets.
Because I think
So when I shared that, I always
talk about it.
people lose their focus for some reason. This is just involved services. And so that's where they were involved with. So if they said 15 hours,
Talk about it here first.
they said that just means they were involved. She's turned around.
Spelling is students.
And it's not
Special ed students.
So I don't like to
All
think of
those things
prejudice
that are making
as what actually exists overall.
know what to do. And so you have a student that does
I'm assuming we're partially through.
you know, the high level.
Yes, actually. Yes, something about it. You know, the report's very valuable because
Hopefully.
Was last Friday the mental health.
Internal process.
Yeah. I don't I can't remember.
Right. I mean, I'm not validating what the discussion, it's just, it's not like, we don't like to have a menu here of things we think we'll ask to move forward. But I think when I think
So they don't initiatives pulls together, it's not even you or someone from your section. They aggregate from Ellen's section. Whatever they do. People who actually on the ground level who understand how schools answer.
Real interesting to me.
And if the kid wants to come back, Jonathan just evaluation.
I saw you.
And then it also.
How are you? I'm good. How are you doing? I'm doing okay. Doing okay. Yeah.
I've seen you back and forth.
Yeah.
Spoken about, but never met in person.
I have to print out some of the stuff.
There was some.
Had that one there for 40 some years.
How do you sit there?
I'm playing.
It'll help you sometimes.
Nobody in the county. So it'll be
That's right. Okay. Sure. Okay. Yeah, that's good.
I appreciate you doing it because it always has
I get it. Okay, no, that's good. Now I'm kind of glad that was. That makes sense.
Yeah. He's right. He's actually the I was talking to
okay.
she's a supervisor.
Okay. Is that a new role for her?
Well, yes, it is. Now, she's been doing it for several years. I think she had just started that. Team has been together, I guess, for 5 years. So Debbie, they're technically or exclusively our school staff.
Oh, yeah. But thank you.
Well, yeah, the hospital's trying to.
Well, let's hope. We'll see.
The ones that are ultimately not competed, there was so money, and they had to figure something out as to what to stay.
That's so different.
My sister was sad. That's how I knew.
Yeah, you're right. It's different too. Okay, guys, if we could sit back down so I can keep everyone on track here.
Yeah.
Yes, please. I need them all passed. Actually, I do need a parking.
Remember, because I was
Okay, great.
That is
the House Committee on Safety. You made a presentation. So did our.
Do you know how many cars were involved?
Okay, so do you need more than one?
Yeah, well.
I do.
I know you've been staying busy.
Absolutely.
Yeah, give me a couple.
Look,
We're trying to stick our hand in the back. I got more than you.
Yes, you did.
Thanks.
About the students when they were hospitalized in that regard. I'm going to say that is a
Okay.
big area of challenge.
Very good. Very good.
The fun part.
Now, sometimes
The gavel.
So at this time, if Stephen Walker could do the review of sexual harassment training, please, sir.
All right, so this has to go more with sex trafficking and human trafficking and sexual abuse. In Senate Bill 548, in the original bill as filed, there was some training provisions that were put in there. We were very cognizant of one of the concerns we have here on our sheet of not training to death, training teachers so much that they were taking them out of the classroom, and so that's why it would have been once every 3 years. Kind of the impetus behind it is our desire to see human trafficking in North Carolina and really in the United States eradicated. And one of the things that we found through research and through a lot of studies that have been done working with victims of human trafficking, especially sex human trafficking, there's two types of human trafficking. There's labor trafficking and sex trafficking, but people that are survivors of sex trafficking, a very high percentage in the 90% were sexually abused as children. And when they're sexually abused as children, they feel like their self-worth goes way down. They see themselves as a commodity and see themselves as worthless. And so the idea is if when these children are sexually abused before the age of 18, if we can catch them, get them the help that they need, then we can help prevent them from being involved in sex trafficking later in life. Because a lot of times this isn't we think, some guy's hiding behind a bush and grabs a lady and then she's a sex slave after that. That's usually not the way it works. It's usually, an older man comes up, oh, you're beautiful, you want to be a model, come let me take pictures of you. And the next thing she knows, she's a prostitute. And he's the pimp. And that's what's happened so many times. And so we want to try to get rid of that, and one of the ways we can do that is to help these children right after the sexual abuse happens. So the idea was for teachers to be able to recognize the signs, and then rather than try to investigate themselves, get the child to a professional that is much better suited to be able to deal with these types of issues. So that's it.
Okay, guys, on to the discussion part here, and making sure that, first of all, that anything that we discuss today that will adhere to the sacred elements of not making it too taxing on teachers' time in the schools, any new trainings that we propose, and also any financial resources that it's not too taxing, literally, on the schools financially to do that. So if we could adhere to those sacred elements there and make it so there's not burdensome costs for schools. So I'll open the floor here. Any trainings that we talk about, I'd like to discuss, pros and cons to any mandatory trainings or encouraged trainings that we want to propose. And sorry, can I just start with Drew down at the end there? Exactly, if you could sum up what you were talking about as far as the embedded process that you already have in Wake County as far as helping a student and then the outreach with providers.
Sure. We have a team of care coordinators that are actually employees of our MCO, but our county funds this particular team. And they work exclusively with helping access services where there's been a barrier. So that the systems that are normally in place work most of the time, but when there's a barrier to being able to access services, or to access appropriate services, they help identify where there are gaps in services throughout our county, and all of that, they're able to feed that back up. And so they're a go-to resource for us if a family, when we talk with them about the potential need for engaging in services, they're able to walk them through that. They are also able to develop that connection with the agency. One of the unique things we've done this past year, though, has to do with hospitals, where we typically don't know when a child's in a hospital. We just know they're absent. And especially when they've gone into the emergency room or something. And what they've done is two things. One is they're able to link with the emergency room, and so they know every Medicaid child reach out to the family to get a consent to communicate with us. And they've been extremely successful in getting that consent so that they can then communicate back to us. We've also had a number of cases where there actually was a legitimate threat, and they picked it up by going through their clinical review. And in one case, we did also had done that, but the sharing of that information allowed us to bring that together. Also utilizing law enforcement to do some preventative work around that. So having that team approach has been very helpful. Now, also when children are placed more long-term in hospital, they do the same thing with an eye towards re-entry back to the schools and communicating, because there again, without parental consent, we don't have access to anything there. And we don't necessarily even know where they are to try to get that. So that teamwork has really enhanced our ability to serve our kids and to as Frank was talking about, when they come back, to be better prepared for what are the issues that are there, and how do we support that.
So as far as reentry goes, then what is the mandatory training you have in place for the teachers to look for those signs? And is there mandatory training for Wake County Public Schools right now for the teachers to have for those particular students in those situations?
Well, I would break that out as two different things. We don't have any mandatory training relative towards discharge of children. We would develop an individual plan relative to the needs of that child within the context of what I was just talking about.
Mm-hmm.
Now, we don't have a universal required training. I think I understand where you're going with that. Those are separate things. What I was addressing. Now, we do in terms of like signs of suicide, human trafficking, different, and bullying and all of that. We do that universally throughout our school that are topic related, but no, we don't do a generalized.
Okay, thank you.
The care coordinators, are they in school, or do you have just a certain number of them? Are they at the hospital?
How
many do you have?
They move all around. There are 8 of them, but when I say embedded, some of them actually are housed at a school, but they don't serve a school. They serve the whole system, whatever the need is. So, but they're only engaged in working with cases that overlap with us. They're not taking that on as an add-on to the population in general, in other words. And so they're not. Now, Alliance does have some staff who are located at schools, at hospitals. So they will piggyback with them to pick up and do more in-depth evaluation of what the school needs are, communication with us, and helping that family get their needs met back when it's a school issue. Whereas a lot of them, it's not a school issue other than that they're absent during that time. So they wouldn't be engaged.
How much communication do they have with the school social workers?
They have communication regularly. What I would say is it's not exclusive to school social work.
Okay.
It is primarily our student support staff who would be making that referral to them, because that's who would have been communicating with the family about the situation and the need for some intervention. Okay. So that's what it would be. It may tend to be a school social worker in some of our schools, because that's one of the roles they have. Right. It's not exclusive to that. Okay. And teachers will occasionally make that, but we've tried to do it again with the student support staff because of their role in actually engaging with parents around those specific things, whereas that's not something we're encouraging our teachers to be communicating with families about, the diagnostic needs of the child.
Right.
Then once they get it, they within 24 hours on the work day, they're notified back that they're notified then when the child is linked for assessment and then when they're linked for treatment. They then follow up periodically to see if they continue to be engaged in treatment. And that part doesn't get reported back to us because that's parental choice. But there's at least a follow-up to see if there was a barrier that caused that to drop off.
Right. So are these the Medicaid care coordinators you're talking about?
Yes.
Okay.
There's a specific team of those, but that's their title within.
Right, because they exist across the state, you know, for right.
As far as I know, this is the only team that's funded and functions in this way.
Okay.
One of the core functions of the local management entity and care organizations is to have care coordinators available for all populations who are eligible and whose needs are met in the public sector mental health system. And in the case of Wake County, there's an agreement about how those particular team of care coordinators might work with the schools to facilitate smooth community transitions and enhance the communication. I think I've heard that communication is not smooth in community reentry or in transition in and out, and we know that to be true. And this is one mechanism that can be employed.
I think it might be helpful for Lee and me to share a little bit about our work with the General Assembly and being part of all three of these discussions. Before we start that, I do want to just say two things. We have 115 school districts in the state. We have how many charter schools?
173.
73 charter schools. They are all unique and different in their capacity issues. Their communities are different and their capacity issues. So I want to be very careful that as we go down the road of this discussion, that what might work in Wake and the resources around Wake County may not work in a Bertie or a Halifax where they can't even get licensed teachers. And that we're not putting some kind of burden on those districts that just is not attainable whatsoever. The other thing that at least our organization feels pretty strongly about is that we do not want to become full-blown mental health clinics. We think that there needs to be a lot of strengthening of the LME, MCO side of things, and that those need, and we're happy to provide them space in our schools because that's the easiest way to get to the kids. We understand the transportation issues. Parents may not be able to take kids, whatever, but we don't want, nor do we think we could ever become those full-blown kind of mental health agencies, and that it's not, you know, part of our appropriate mission in all honesty, but want to be there, and we want to basically find, refer, support, but not be that main part. So state board started out with their mental health policy, as Bill mentioned. Both Lee and I did a lot of work on that with Kathy's help. We still had some pretty significant concerns when it passed. One was that it was a policy and that there was no legislation behind it, which was one of the benefits of Ashley's piece, that we were able to get some immunity protection. The state board doesn't have the ability to grant that. And so then the suicide prevention piece came out. They seem to not necessarily be linked. And so we thought it was very important that obviously suicide prevention is part of mental health, and that it should not be two separate discussions, and that we needed to start marrying those together. And then the Lieutenant Governor's piece came out, and we got to spend a few hours on the phone one night and kind of folded that in as well. And so, I mean, I think kind of some of the major points to us is one, that the basis of all of this be in legislation so that school districts can provide the proper immunity coverage for their school employees. That the training not be burdensome on teachers and other school personnel from a time perspective, that we need to make sure that we are preserving enough time that they are still getting the pedagogical training that they need. And in all honesty, we don't have enough time to do training. That's just how it is. That it not be cost prohibitive. And we have some concerns of requiring training outside of our professional employees, because we would have to employ them for additional hours, and thus it is an unfunded mandate to the district that we would like to start off with saying they're not precluded from doing that. If they have the resources locally to do it, that they can choose to do that, and kind of see where we go with that, and that it be on a structured basis, so that, one, we're not having to do a whole lot of paperwork that's not administratively burdensome for districts, and that also, if, for example, it's going to be required that every other year, or in even years or odd years or whatever, that suicide prevention be, let's say, the 2 hours of the 6 hours of training, that there be an out for the state board, so that if there is an issue that comes up, that they have the authority to say that we are in a crisis on this issue and we need an exception this year. So, and we can't anticipate everything. I mean, 4 years ago, we would never have known about the opioid crisis that we're going through. And so I think the legislation needs to be flexible enough so that we can have those kind of outs, and that we don't have also the prescriptive, the training shall be A, B, C, D, E, F, that be left to the state board, because those trainings have a tendency to change over time as people learn what works and what doesn't work, and so that the state board is in a position to be more flexible to do that.
Yeah, I think she did a good job of summing up what we did. We worked with Senator Krovic to put together a PCS, a proposed committee substitute, to move last year. And just to sum up what she said, there were kind of 4 guiding principles that we used. You know, one is that it be practical and effective, and you can't be effective if you're not practical. We wanted to protect our teachers so that they would feel comfortable in acting, and we wanted it to be forward-looking. As Leanne said, today's issues are not going to be the same as the ones 10, 20 years from now, just as today's issues are not the same as the ones 10, 20 years ago. We want a plan, a framework for training that will act in perpetuity, and that was what we sought.
So a couple things I would bring to the table.
Erica, you want to distribute that?
Oh, yeah. So I have real quick question. So the ultimate goal would be like recommendations to the legislature. I'm sorry, I'm thinking out loud here because I wasn't here last year whenever all that happened. So recommendations to the legislature on what you want in law, essentially. Like that's.
And one point, the only group that can provide the legal protection that we're talking about is the General Assembly. So there's a lot that can be done internally, DPI, but that has to be done over there. That's why we sought a legislative solution.
And I will say also, and thank you for the comments, and I look forward to working together this session. And I think we all are seeking the same goal because we very much want to be sensitive, obviously, to the teachers and school personnel, their time. One of the reasons with the approach in 285, the 2 hour, is that it is flexible. It's offered online. It can be taken anytime, once within that two year, every other year period. So it's designed really so that it should be user friendly and at a convenient time for individuals. Also, with the LME-MCO aspect, which is a key, vital aspect, but that is looking at a limited number of kids that are eligible for those services, and this training would be for for children across the board. so that there's that aspect too. And then also we do have in the language that it's either the 2-hour training, which would be available for those districts that maybe don't have the resources to put together a solid local training, but it gives them the option. You can either have this free resource of the 2-hour training or do a local training.
Yeah, one of our purposes was not to preclude local initiatives. In fact, to encourage them. And create a clearinghouse, if you will, through the superintendent's office that would let other districts know what's working in their other districts.
Thank you for all the work that you've done, and I completely agree with you when you said we didn't want our schools to become a mental health office. That was never the intention, nor is this what the teachers were trained to do. So I can completely agree with that and appreciate that. However, I do think that our culture, where we are right now, school culture, school climate, is in desperate need of social emotional training within schools that is apart from the academics that they do. If our goal as educators, I know my goal as an educator is to prepare my students more for the world than when they came to me. And if they don't have that training of how to be, a good citizen or socially acceptable behavior and emotional behavior, because the mental health piece of it, when they do go see a counselor, we're kind of in a reactionary situation there, whereas a training or some sort of training in the schools, embedded in the schools, a social emotional training would be a preventative measure for a lot of these kids, and I think that's so important. Our culture has shifted, and I think there's a desperate need for that.
So one of the things that we know from early on that works is system of care. All of our communities have LME, and as part of that, creating memorandums of agreement with our communities. And I think part of what needs to be in legislation is some ability for all these agencies to communicate. Because right now, one of the barriers is, everybody has their own rules about sharing, what you can share and what you can't share. So if I'm sitting in a school, and I'm sitting in an IEP meeting or any meeting, and I've got a case manager there from social services, I've got a counselor, I've got an outside provider. Generally what happens is when the discussion goes on, we've got 4 people, working on the same kid, but the right hand doesn't know what the left hand is doing. And it's a huge barrier, and it's one of the reasons why it's easy for a child to drop through the cracks. With a system of care approach, which we've all been involved in, what it brings to the table, is a strength-based approach. So you're working within the strengths of that family. The family is sitting at the table, and everybody working with that child is represented at that table with a single case manager, that in those agreements, different agencies can provide, opportunities with agreements to have individuals from their agency, become case managers, whether it's somebody in the community, whether it's somebody in the schools, providing in-kind services. So that's one piece. And then the communication piece, the sharing of information, I think is another piece. I think also that all of you are aware that right now what we're scaling up in all of our public schools, from the smallest school to the largest school, is MTSS. What MTSS represents,
I'm sorry, what is that?
it's a multi-tiered support
Okay,
system.
thank you.
See? Anti-acronym.
Forgive me.
Sorry, it's not one I use very often. I have heard it now.
So the reason we decided to use a multi-tiered support system, is because it provides a tiered system of supports. Key operative word is for all children. So, you know, we work from tier 1 all the way up to those kids at tier 3 who need intensive support. So what I would encourage is that we don't create new structures. We already have a new structure in place that literally every teacher in North Carolina is getting trained on now.
Not really.
Well, by 2020, like all of the charter schools, you know, all of our schools from preschool all the way up to high school should have had training because we're providing that training in cohorts. So everybody in the schools is getting that message. And that even ties into our, you know, mandate, you know, with July 1, 2020 with kids with specific learning disabilities. You know, but I think the key is we have a structure that we're building that will, if we build on it, create a full continuum of supports. And it would allow us to also use a system of care approach, and it'll serve all children. It won't be isolated to one group of children, whether it's general ed kids or special ed kids. So I think we have to, I just don't think we need to be creating, in whatever we do, more fragmentation in schools. And that's what we've done for the last 40 years. So part of what we have in legislation, I think, has to build on existing structures. And I would love to see the system of care, which really worked when we had funding for it. You know, I was actually a chair of the school board when I signed our agreement in Watauga County. And the reports from parents in those collaborative meetings, the parents from, the people sitting at the collaborative, the success we were having in helping children was like amazing. So those are like 3 points. You know, build existing, stay with our existing structures, think about a system of care, and build in some way for us to like share information, which is so vital if we're truly going to be able to like work together and help kids.
Yeah. It might need to be under, and I get it. I think the MTSS has some good qualities to it, but the teachers just don't see it that way, and there's nobody to train the teachers on that, and there's so many drop balls with it at this point that if we were going to say, okay, MTSS, you know, that's our design or whatever, it might have to have a new name, because when there's MTSS training, oh God, what time is it? I better go now. No one's going to, it just hasn't been effective, I know, just generally speaking in our district. But
can you explain what that is from a teacher's perspective, like what it looks like, what you know about it, what you...
Sure, and Mr. Denny, you've done a lot of work with MTSS, but from a teacher's perspective, so if there's a child at risk of failing any subject, or it could be a behavior situation, then those children literally get a red folder. The teachers get a red folder. It's probably different in each district, but at our school, anyways, we get a red folder for that child. And it's just, are we keeping up with that child? It's kind of what we do every day as teachers, but we have a folder there that says, okay, every 3 weeks I need to check in with so-and-so child here. How are they doing as far as their English score now or their math score? How are they doing on their behavior plan that we stated that 80% of the time they will respond in this way, or 80% of the time they will have comprehension about, certain element or certain standard. And so over time, though, we didn't, like for instance this year, didn't ever even get a folder on the kid. And I'll tell you why, because there's not been any follow through, which is the key with teachers. I will tell you is the key with teachers. If we don't see any follow through, or let me give you an example. A couple of years ago, I kept 6 red folders on these kids and kept up with them every week and all their scores. Well, at the end of the year, when we were having waivers and all that sort of stuff, no one ever asked me for any of those 6 red folders that I'd done all this work for. And that made me mad. That made me mad as a teacher. I feel like, wow, that was a colossal waste of time then. If no one's even asking me to see any, they just moved the kid on through without even asking me about it. So that kind of feedback and that lack of follow through is what's in the teacher's mind when it comes to that, which shows that there wasn't value placed on the extra work that we were given.
Yeah, to go to your 3 points, we agreed with that. We felt the proper place to handle all 3 of those issues was the office of the superintendent. That was about as high as we could push it. And to go to your point, we kept the local support plan local so that it would meet the needs of the local community and the local school system or the local charter school versus state mandates that you check a box, put stuff in a folder, and nobody does anything with it.
So the way to, and this is just common sense, the way to encourage people to make the decisions you want them to make is by giving them tons of information, good and bad, and just assume that they're going to make the best information or the best decision. And so it's almost like saying, all right, local district, I'm not going to make you do this training or this whatever, but you have to do a type of training, and here are your options.
Yeah.
And I can tell you, these are quality, these are not, but here are your options.
And for those of you who don't want to create your own training, here's a ready-made product for you.
Right. But then you get into but then you deal with programs that are low quality, and so how do you combat that?
We're not programs that are low quality, but the buy-in. There's no buy-in, and the buy-in comes from the top down. And if there's no value placed on that, then any program, no matter how spectacular, is just not going to be valuable.
So I would just say this in fairness to MTSS. First of all, it's all about school improvement, which is what every school board member is concerned about, what every parent is concerned about. When I use it, because there's nothing specific in training about red folders. It's just how an LEA implements it. But under the umbrella of school improvement, the focus was in the beginning working on core instruction, because there are obviously many students in our schools who are failing academically. And if they're failing academically, believe me, they're going to have social emotional, mental health issues. So there's a direct link between, academics and social emotional learning supports. So with the whole idea of, MTSS, you work on whatever the needs of the student is in core. Core is academics. And if you see somebody that's not successful academically, as a result, by the way, of universal screeners, which I think we should be using, to identify kids who have, suicide symptomatology, mental health issues, because we've been successful with universal screeners in really decreasing the number of kids who, for instance, have, reading problems, which is like the #1 referred area in schools, right? So universal screeners allow, those kids who are struggling behaviorally, social-emotionally, academically, kind of rise to the top. And then we can target, evidence-based interventions there. The whole idea of, MTSS is then if a student needs supplemental supports at Tier 2, again, it can be behavioral supports or social-emotional supports, academic. Then we can do that in small groups, using what we call a standard protocol approach. To save time, we can work with 3 or 4 kids at a time, very much like we do in group counseling. If we have a child who has like a mental health need, a behavioral need, an intensive academic need, for instance, if we have a child, like I work with every kid's in supervision, where a kid is in 6th grade, but the kid is reading literally at 2nd grade. Now, if you're reading at 2nd grade and you're in 6th grade, you're not going to be feeling pretty good about yourself. Right. And you're probably not going to be the best kid in the school, but yet don't you have that primary need for attention? So, I think that's where kids get in trouble. So I think the more kids that we can guarantee success academically, we're going to cut down on some of the problems. So I think having those multiple tiers in place is huge, as well as using universal screeners. And we do have like really good exemplary schools in North Carolina who are doing some awesome things with MTSS, because I've seen the data. And the data where we've really cut the number of kids down who are struggling academically. And we have PBIS tied in there, which is another thing unique to North Carolina, that we're scaling up MTSS as well as PBIS simultaneously and building on those existing structures.
So I'm gonna tell a story real quick that hopefully will hopefully it will attack some of what we're discussing and reframe. And so if I go down a rabbit hole, I'm sorry, but I'm gonna try my best. All right, so I had a student. I will not say his name because I don't want to get in trouble because y'all know all about student privacy and I'm not as great on that. So we'll just make up a name. We'll call him Jalen. Okay. So Jalen was in my class and he had a few behavioral issues, not anything that was, like disruptive, but he did some things that alienated other kids. They thought he was weird. They bullied him, which only reinforced his behavior. He was like that in another teacher's class. So he was exhibiting a few behaviors that were not just disruptive to him as a soul, as an individual, but like to the classroom and their learning environment. And so the problem there is that I didn't know what bullying was, right? So that was the problem. I was never trained on mental health issues or like what to flag. So to me, I just chalked it up. Well, he's a little strange, like he's just weird. But he's a great kid. We'll work with him. That was one problem. So I was not told what we needed to do. All right. Secondly, this other teacher and I tried to call his mom, and she just was not cooperative because I think it was hard for her to hear that her son was doing some things that were strange. And so she was not cooperative. So that was a roadblock. that, you know, we didn't know where to go. If the parent was not going to cooperate, what do we do? So we went to the school psychologist. No, I'm sorry, we didn't even have a psychologist. I think, so we had no Rachel. We had, I think she was just a counselor, which meant she was a testing coordinator, sadly. And so she was not helpful. So that was another roadblock. So we have two teachers trying to figure out what we need to do for this student, and I already forgot the name. Oh, Jalen. So I almost said his real name, and I hope I haven't done that yet. But anyway, so we have all these roadblocks. We don't know what if we should be looking. We don't know what we should be looking for. That's a problem. We can't always assume the parent is going to be cooperative. The other problem is that sometimes the student support staff is not going to be helpful. So what do? We Googled like resources in the area, somebody who can come in and evaluate. The only people we could find charged. Like we would have to pay whatever, and we would have to get the parents' approval. Yeah. Anyway, long story short, we were blocked. Eventually, the student was suspended. I don't think he was expelled for stabbing a kid with a pencil. And so, like, that goes to the school safety issue. It's like, how could, that's something we could have prevented right there if we had not had all these roadblocks. So I think for discussion purposes today, we have to assume that there are always going to be roadblocks, and any policy is going to make sure that we alleviate that. And I love what you said about communication, is it is putting it out there. If there had been an online, and at the time, I even checked DPI's website, as y'all know, it's you get lost in it, okay? It's like a forest. And so, check DPI's website for resources, couldn't find anything. But if there is a teacher who, regardless of all those roadblocks, could access something at DPI or somewhere where they could go to get free resources, I think Jalen would have had more options, and maybe that student would not have been stabbed. So, yes.
And I'm down in the trenches. I work in schools every day. I work with kids every day. I see them face to face. They know me, I know them. There is an issue with staffing ratios. When a teacher needs support, who can they go to? We are understaffed. We're 3 times the national average in the state. And one of the things that psychologists can do is help teachers with analyzing that data. It can help teachers with doing those interventions. We have a lot of staff in school that are trained to be able to take some of the burden off of the teachers if there was only enough of us to do it. So I think anything that we can look at to help bring that support staff out of the isolated bubble they're in with doing the same things every day where they can't get out and help.
I appreciate. I'm sorry.
I was going to interject real quickly. I mean, the House School Safety Committee, in their presentations, said that our state has 1/3 of the national, the recommended national. And I think there's a real effort in that committee, at least, to work toward moving that ratio up.
I appreciate your comments because I've been sitting here the whole time, coming unglued as a social worker, and my apologies in advance because as this group meets, you're going to hear me say this a million times. I worked in a jurisdiction that had a system of care in place called the Jason Network. It was phenomenal, but teachers were relinquished the responsibility of the red folders because the social worker, which was assigned to the school with ever how many other social workers were in need there, they were the hub of that wheel, and they coordinated with external and internal case managers, DJJ, whatever was involved with that kid. And when they needed to know for a team meeting what the English grade was, the social worker was the catalyst of getting all that information, making it easy for teachers to instruct and look for characteristics that they were trained in, but also, yes, they're not doing very well. It wasn't so tedious. I was just recently doing some work in Davie County and spoke about this meeting, and the social worker there that's in charge, she reported to me that they have 3 social workers for 12 schools. So that goes back to Caroline's statement earlier in the meeting. We are becoming a reactionary system in totality, from administration to teachers to social workers. You cannot run effective programs. You cannot be on top of those children in need. You can't recognize behavior changes or characteristics of suicidality or lethality with having 12 schools and 3 social workers. It's just not possible. And I know that we always want to be financially responsible and not ask for more manpower, but without it, And without putting those behavioral specialists in the schools, we're going to be here next year and 5 years from now talking about the same thing.
So it sounds like this group highly recommends like staffing ratios suggestions, but that's already happening, right? Like, is that are there already groups that are recommending ratios?
It's been
to the
recommended to
okay.
that legislative committee.
Okay.
That's looking at short session legislation and also funding.
But it really is not just the ratios and trying to get basically more money on the street so that we can hire more guidance counselors, nurses, social workers, school psychologists. We have got to get into the pay scales because we are competing with the private sector, and they could throw all the money they want to at us, and if we cannot pay them what they can make in the private sector, we will not get them.
Do those ratio recommendations include all of those? School nurses, social workers?
Nurses are being looked at through that policy, program evaluation division study, so that's actually a separate committee. I don't know how much the committee that Kim is working with is looking at that, but they have draft legislation coming out of that.
I agree with that, because one of the problems we have in all of our support areas is really recruiting, because of the massive shortages. But a starting salary for, like in my area, where I'm training a school psych, which takes 3-4 years of graduate training, and they're going to graduate and make in North Carolina $43,000. Oh, there's no way to survive on $43,000, and pay your debt that you've had in school. When the median, nationally, is 61,000. So, we're so far behind. We could recruit nationally, if we would get our pay scale up in North Carolina in all of our support staff. I think the other issue for me in licensure is, like in my area, there's no reciprocity. Yeah. So if I recruit somebody from New York, and they're a nationally certified school psychologist, they cannot come into North Carolina and automatically get licensed. They have to jump through another set of hurdles internally in licensure, which creates, when you talk about roadblocks, if you've ever talked to anybody who tries to get in North Carolina, like they call me personally, and it's like, how do I get through licensure? When they've already got the highest credential, they could already hold. So that's an easy fix. That's an internal fix. Doesn't cost a single penny.
And that's for school psychologists. Who else?
Clinical social workers.
Yeah.
Counselors.
LPCs.
Counselors. Yeah. Reciprocity.
I mean, if we really want to talk about it, we can talk about teachers.
Yeah.
We don't have reciprocity.
Well, we've got a lot. We've got some.
We've got some. It's better than it was.
Right.
But
And also in regard to the school nurse shortage, that the program evaluation report, the meat of that report is really moving and looking at not only the increase in chronic health conditions among children, but also the mental health aspect. But the national ratio is the 1 nurse to 750 students. In North Carolina, we're closer to, I think, 1 nurse to every 1,200 students. Wake County has a significant shortage of school nurses. So, really, and your comments at the first school safety meeting about, it being, a comprehensive approach, but looking at all of these professionals and the need for that additional support in our schools is just so important and such a part of school safety and mental health.
Carolyn, can I ask a clarifying question? So we've spent a lot of time talking about different trainings for staff, and I know that the focus of our charge includes things that will happen at the school. But I've also heard lots of concerns about required training and expensive training and teacher time and all the other training they have to do. It seems like we can't have the what happens at school conversation without the conversation about what happens in the community, like making those linkages. So can part of our discussion and recommendations include like system of care or other things? Because it seems like depending on the school, I mean, Susan was telling me earlier, some local school districts have invested in staff on site that provide mental health counseling. That goes well for them, they get good outcomes, whatever. I could certainly see schools or districts, or both, that is not how they want to do it. They either want schools to have the ability to refer out or have people come in and do it on site, but not to be their responsibility. So it seems like you need an array of options that districts can decide this works, this doesn't. So is that all included in what we will discuss and recommend?
And how do we know what is really working? As far as if they say, no, this works, well, tell us how it works. Exactly. Okay. How is it effective in your district? By just, instead of just telling us it works, can you show us the results of what you're saying works? Okay.
So all of that is on the table for this group. Is that correct?
Walker makes a great point there, and I think it's one that also Leanne and Lee have made as well. We can't have a one-size-fits-all for a state that's got 10 million people, 1.5 million students, 115 LEAs, and 173 charter schools. You can't say, okay, we're going to have this one policy, and that's going to fit everything. You know, each of these 115 LEAs, they can supplement pay any way that they want to. They can do this, and so I think we have to remember that there's other options besides just telling the General Assembly, throw more money in it. If you'll throw more money in it, it'll fix everything. You know, when we're, and I agree, I mean, the funding needs to be there, but the funding doesn't just have to come from the General Assembly. You know, there's 115 LEAs that have tax bases that, you know, when you look at state funding of education, North Carolina ranks about 8th as far as the percentage of education funding that comes from the state. And so the LEA's got to pick it up a little bit on that regard. And I know Leanne's getting ready to answer something.
I'm going to move over this way.
But I think, you know, that's there, and a lot of it comes down to choices. And I think we have to understand you can't have a one-size-fits-all policy for every LEA, for every charter school, for every student that's out there, and to realize that there are going to be some differences that you know, in Anson County is going to be different than Mecklenburg County, and they're right beside each other. You know, Union County is going to be different. Johnston County is going to be different than Wake County, and they're right beside each other. And so I think we have to remember that when we're coming in and we're making these recommendations, that we've got to give some flexibility to these local school boards to you know, to make decisions that actually match up with theirs. And they may not all want a school psychologist in every school, or social worker in every. You know, they may not want that. They may say, well, that's not what we need. And so we shouldn't force it on them and force the cost on them. And then say, well, the General Assembly didn't fund it. And then the LEA's like, we don't want to fund it. We want the General Assembly to fund it, and then just nothing happens. And so if we give some flexibility, maybe we can see something actually move on this.
But I think what we can agree on, and this was covered in the mental health initiative material, is that kids need access to services.
Absolutely.
Yeah. Right, so how that gets delivered, you know, but there should be an expectation that
it's going to get done.
If you're, that somebody's screening, that someone's referring, that, you know, whether you're Medicaid or uninsured or commercially covered.
Every child deserves that, no matter what county. So that's kind of the goal. I'm going to let Leanne respond, and then Susan wanted to say something.
So, yes, local boards can put potentially some money on the table, but we are one of the few states in the country where school boards do not have any ability to raise their own revenue. They rely solely upon their county commissioners. And so you've got multiple layers. I mean, there are things school boards across the state would love to do, and they just cannot get the local funding to be able to do it. And the flexibility, again, I think is important, because you may have a district who says, you know, we think we might be able to find school counselors, but just kind of given our geographic area and where people enjoy living in the state, we're probably not going to be able to find a school psychologist to come in. And so we have thought all along that flexibility in expanding the pool of these support services needs to be community to community about what they think they can actually attract to come.
Susan.
Yeah, in listening to everyone's comments and points, it seems to me that we're all coming back to something that the School Mental Health Initiative is really engaged in, and that is beginning to do some pilot work with doing direct community needs assessments within the school, and that community engaged in that process, and forming a plan that's individualized to the community, to specific schools within that LEA, and perhaps even child populations within that LEA, and really the local education agency, and really also engaging what happens from the school door, home, and back, right? And how that connects, going to what Walker was speaking about. And I do think that the SHAPE process does help. We spoke about that earlier. I do think that really helps us to look at that. I think that the multi-tier system of support really also does that. From early childhood on, we haven't really talked about early childhood here, but North Carolina has done some amazing work around the foundations for early foundations on social emotional learning, something that other states drool over in terms of public instruction's investment and paying attention to this early on, looking at those foundations early from 3 and up within the school system, and paying attention to how that connects to multi-tier system support. It seems to me that there are a lot of elements that are aligning, and there's a lot of processes that we have in place both in the community that we know have worked, paradigms that have worked, paradigms to some degree still exist in some communities, to others not so much, and a lot of communities who are engaged in the dialogue of let's do something. So I wonder if it's an opportunity for this community to point to some of those things that are work, highlight those, and then still identify. Erica, I kept hearing you ask about, well, who else is supporting this? Would we support something more unique? Would we support something that doesn't have a red flag on it right now? And I think that's the opportunity to also look who's promoting school social worker ratios, who's looking at school nurses, psychologists, paying attention to those, saying what else pulls this together for us. And it seems that we've all talked about that. It all fits together for me in really looking at alignment within the school, alignment within the communities, individualized approach to what can be supported when, but then also overarching state agency support, cross-agency support for taking some next steps together. So I know there's been a lot of different pieces, but I think there's a lot of strong alignment. I'm not certain what our next task will be, or our timeline, but I think we've got some good bones.
If I could direct you to the proposed recommendations that you did pass that out, that Erica passed out to everyone to see what you guys thought about this. The initial training for classroom teachers, newly licensed in North Carolina, 4 to 6 hour program, developed under the supervision of Superintendent's office, offered online or through universities to college students if they're currently getting their teaching license there. Topics to include, and these sounds like can change from obviously year to year, whatever's current, whatever, as Leanne mentioned, we wouldn't even be talking about opioids 4 years ago. So that's something, that can change with what the current topics are. I also thought about just resiliency in there as well. But right now, suicide prevention, human trafficking, sexual abuse, substance abuse, general mental health issues, and other issues as approved by the SBE. And then annual update for all classroom teachers. after that. So this recommendation is out there right now. What are your thoughts?
I would just add one more recommendation that's not on here. While I appreciate the whole school, whole child, whole community model, I think it's a great idea. Wraparound services is very important, especially what Jim said as far as having everybody at the table and being able to speak freely. I think that's very, very important. But looking at that model and walking into a school, and we have 2 pictures of it in here. And, you know, some people say pictures is more than 1,000 words. And, you know, where is the responsible adult in that diagram? Yeah, see the child, and you might say it's over in the family engagement. And I have suggested it for quite a while. A responsible adult needs to be somewhere in that diagram, and I've made a suggestion to put it behind the child. Just a silhouette of an adult. That's the sad thing about little human beings.
Or the silhouette of many, because there's so many hands on deck for that one child, you know.
Right, but just at least one major adult, and we hope that that would be a parent. Doesn't always be a parent, but at least then when whoever is the person that's signing the child into school, I need to look at them eyeball to eyeball, shake their hand, and say, I am so glad you're here. You are the responsible adult in this child's life, and we can't do it without you.
Thank you.
I mean, that doesn't cost anything. And you can start with the diagram. Now, some people have said that we can't change it because it's CDC. And it's ASCD, which I'm not even sure what ASCD is.
Acronym.
Yeah, I know it's American something, supervision, curriculum, something.
It's interesting to know, like, if there is a description of every sort of training. So if, let's say we say, or this group recommends these trainings or these issues. It'll be interesting if we note in whichever training options are out there, if part of it is, all right, teachers, here's not just what you recognize with the student, but the parent as well. Here's how you communicate with the parent. Here's what you don't say. Here's what you say. That might be an important piece whenever districts or schools choose like what they want, how they want to train their teachers.
But every parent that works in the school, I mean, I know these posters were handed out to a lot of places, and when they walk in, they may be off to the side with family engagement, which is important. I want to leave family engagement there.
Caroline, what is the framework for this? Like, if we talk about this as a recommendation, does it go to the state board? Does it go to the superintendent?
Defer to Erica on that.
But
it goes to both.
Okay. So yeah, the state board and the legislature, they'll get a report with our recommendations on that policy. So on all those trainings, but anything else that we find relevant.
Okay.
Yeah.
So I may have missed this in the beginning. So are we going to be, he mentioned some tight timelines and some longer term, but like, are we going to be have a series of meetings before this report gets developed that will include this recommendation? And this is just the first one we've seen, or is this something we're supposed to decide today?
We'll have another meeting, one more in-person meeting before the end of May.
Okay.
And the goal of that is to finalize the recommendations. The good news is that a lot of that work you can do online before, providing feedback, inserting comments, all that stuff you could do before. So it's not, that won't be a problem. But his vision afterwards is developing some sort of continuum so that, the more things change and the more trainings change, keeping this group going to monitor quality of whatever is out there and given to our schools. Because y'all know best. Like, there are so many folks out there trying to sell their, training program.
Okay. So theoretically, the recommendations that we'll look at first, because 2 meetings is not enough to do an exhaustive, will come from the mental health initiative, the school mental health initiative. Is that sort of where we'll start?
Yes. So and that pre-reading is that original policy.
Yeah. Okay.
And so figuring out if that is the policy.
Okay.
What are our recommendations on
Yeah,
that?
Okay.
Erica, my understanding was the purpose of this group was to create a framework ongoing.
Yes. Yep.
Okay.
Yes.
Because this is really about teacher training, and I think we want to be talking about child outcomes.
And that's what you hit on earlier, the connections that everyone has outside of the school.
Yeah.
So my thoughts, just as someone in the school every day, is what do they say? An ounce of prevention is worth a pound of cure, right? I think we should be heavy on the preventative tasks. This is prevention. This shows what this is. This shows that a teacher is now more aware, has that awareness out there of kids that are struggling with mental health. I also think, as far as prevention goes, I don't think this should be it. I think there needs to be an advocacy program in the school that focuses on social, emotional training, character building, character education that is in every school. So I think those are two strong prevention pieces that if every school put their own little stamp on it, created whatever they wanted to do with it, we would at least be getting somewhere with prevention. And then for those kids outside of that school area, so we have those connections, and you said it much better than I ever could, but also to recommend what you said as far as we have all the supports in place. I think that would be a strong, good starting framework for us, for this group.
How does the 2 hour...
We got several pieces of paper that came around. I'm just curious is there some explanation of this and what the various boxes mean? Because what worries me about what we're talking only about training here, and the issue is a plan. On the bottom of this, there's conversation about a plan. So I'm curious what the details are about that.
You'll see in the legislation, in the draft. That's the more detailed version.
And I'll just say, I think,
In what legislation?
I can just,
I'm sorry, Rachel, I didn't see you.
I'm sorry.
So I think as I'm listening and trying to, I guess, tie everything together. When we've talked about system of care. At the Division of Mental Health, we collect data about empty topics for the North Carolina treatment outcomes and program outcomes. So part of that data looks at how many people are involved in the child's life. We know the more positive adult role models they have involved, the better their treatment outcomes. And I'm sure you guys know the same for education. And so when I look at that family engagement piece and the conversations that we have on education, one of the things that costs little to no money that in these groups we always kind of skip past, and Susan alluded to a little bit earlier, is how do we engage that youth and family voice from the beginning of the process so that they inform what it is we're doing versus we sit around professionally and present to them what it is that we feel that they need. And so part of that is them informing us because they are the experts. They know better than us what their issues are, what their needs are, and what their abilities are to access the resources that we make available. Because with all the resources, with all the improved staff ratios, with all the money thrown in the school system, without that proper engagement with families, they're not going to access it. So I think that we need to talk about, maybe, I don't know if it's a recommendation about training, or just a recommendation that we include that youth and family voice as we go forward as a state, but also locally, as they have their local flexibility in determining what this will look like for them. But a requirement within that, or an expectation within that, is that they have that youth and that family voice that helps them develop what that looks like.
How would that look, though, Rachel?
So I think that it will look like everything else different in different places. But I think that without that, what we will do is develop something really pretty that we can often do damage to before it gets there. And I say that by saying some of the things that we've been said around this table, I can tell you if a family member was sitting in here, they would have been offended. And I know it wasn't intentional. It's because we don't know any better. And so we say things that can be off-putting to families that will prevent them from accessing the very best of services. And so if we had a family member in this table, they would respectfully help us change our language and our thinking about how we present those options. So I know some of you have heard before, I can ask you your favorite meal, and if you say it's a steak dinner for Amos Barn, I present to you on a trash can lid. How, it's the best dinner that you can think of, but you want off of a trash can lid. And so I think without that youth and family voice, that's what we could possibly be presenting to our families. So whether it's in the aspect of a recommendation again for training, or just the requirement, the expectation that youth and family voice is involved. And what that would look like, I think it needs to be, there's evidence behind, of course, that youth and family voice and that involvement, so we know that exists. But a structured and systematic way that families, that school systems engage with families. And so how that will look, I can't answer that question for you right now. It'll look different in different places. I have experience and seen it in different places and have learned a lot myself since I've been at the state about engaging with family partners and how they bring knowledge and information to various subjects. But I think that's just something that we need to consider and we need to think about, you know, as we continue to talk today and in time to come about how that will look and letting them help inform how that will look.
And there are state groups that work with children specific to mental illness, and then there are also other groups, at least from the special ed side, that we've created family advisory councils, and we're developing more and more of those across the state each year. And again, the thing about it is it has to be related so that North Carolina Families United, I'm going to name one, that is an example of that group that does have a youth component to that. If you haven't been there in the moment, in the trauma that family exists in, then it's hard to be able to talk about it. When you're trying to talk to them about it, it's hard to not talk about it, but to understand that when you're in there trying to help support what you were saying a moment ago, bring the best services to the table, and then we're stepping all over ourselves in doing that. So it is a crucial piece, and it is a huge element of the system of care and the things that we could produce. I wanted to come back to the plan because I understand policy doesn't give the protections, and that has to be done by legislation. But I also think, you know, there's a lot of research in this policy as to why we did what we did, why we said what we said. As far as just the basic elements, we left lots of things to the discretion of the local LEAs as to what they could choose and how they could choose to do what they needed to do. But back to evidence-based, I mean, what you will see in that white paper really is where this came from, and the service delivery components described in there, prevention, primary intervention, and then the referral elements are key issues to any plan that has to do with this. And if we aren't specific enough about, and I understand, and I truly don't want to dictate, and you will hear, I will talk menu all day long about what needs to go in the individual systems plan based on their needs assessment. But if we don't give local school districts a framework built in research that would provide what needs to happen, and then let them choose what to do with it. But we've got to make sure that those elements stay in our, and I'm obviously overstepping recommendation when I say we must, but that has to be a recommendation that we insert what we know to be the research and what should be there in anybody's basic planning framework. Because I think, again, it is interesting in the SHAPE projects we've got, out of Bertie County, but we got one from right down there next to them who pretty much doesn't have anything, but they're working with what they got, and they're developing a plan, and they're trying to figure it out. And so, you know, I think they're looking at this as a framework and working inside those constructs to make sure that they've got the elements that they need. And I think that just becomes an important piece. So I know we're going to close on time here, and I just want to throw that back in there as we go out to talk about what we're going to be recommending in between now and the next meeting. I just wanted to make that as a discrete recommendation, that we keep the things that we know are evidence-based in the way of framework and infrastructure, and then let them make the decisions about what they need to do.
And just let me point out that the language of what we proposed does exactly that. It allows DPI to make recommendations, but the ultimate responsibilities, the ultimate authorities at the local level and responsibility.
One concern I think just to express in the language is that it doesn't ensure that you would have the suicide prevention training once every other year. it gives the option to spread it out. And going back to the recommendations, which originally we were, every year for the 2-year suicide prevention, the concern would be a loss of effectiveness if you aren't doing it at least every other year. And maybe Susan can speak to that from the task force's perspective.
Well, and again, I mean, we wrote it that way to give an out for unforeseen topics that needed to be addressed so that the state board had some, and it would have to be a state board decision, so it would have to be voted on, so that there could be some discussion. It's not a single person making a unilateral decision to say, we have had this emerging crisis area and we need to delay for a year or skip this time because this is such a huge issue. And so we tried to make sure that we elevated it to a level that if that was going to happen, there would be substantial discussion around not doing it on the every other year time frame. And I think on Bill's point, kind of the other part of what we were trying to do is get that buy-in from the local districts, and not have, hi, we're here in Raleigh telling you exactly what should be in your plan and we're going to give you every detail, but to say, here are suggestions. They are best practices. They are evidence-based. Here they are. Most districts are going to take that and run, but it doesn't feel like you have had this hammer from Raleigh come down on you, and that you get more of the buy-in from the district level, and hopefully then that gets pushed down so you don't end up with circumstances where you have red folders that sit on somebody's desk all year and never get used.
And could you not have both? You could have this training, and then you could have the suicide prevention. That's a life or death issue. Mm-hmm. It's very important that we get that. And I, as a teacher, don't see, 2 hours of my time to learn the warning signs of a kid that might kill themselves. I think that sacrifice, I could do that every year. And I think many teachers would feel the same way that I feel.
And obviously this would not preclude that. Right. I mean, if a teacher wanted to do it every year, they could, but if they've also had it 5 times and the training hasn't changed because there's nothing new to change and they feel like, I got this, then...
And who's going to be in charge of, that's a good point, I'm glad you brought that up, of changing it as it goes along?
Superintendent.
Superintendent, okay. So adding, updating.
This would be under the office of the superintendent directly.
And coming from a very small rural county like Anson, and I again don't know the statistics on the 35 suicides, how many were in Anson County, but let's just say there were not any in Anson County. We have the training, but then we need the flexibility because we've got nothing, we've got drugs, the opium is just, that whole issue is huge. So we need to spend more time on some of those signs and speak up how to tell other people what's going on. Make sure everybody's got that application. We didn't even mention that today, the Speak Up application. I think that's the phone, so that folks can share information. I think that's critical.
I mean, we had a few years back this rash of gang emergence down the I-95 corridor, and it was that corridor because of traffic coming down I-95. And I mean, we had districts who had never dealt with it before. I mean, I remember in particular one school district was like, we've never had gang issues, and all of a sudden they've come out of nowhere, and we have got to deal with this. So, I mean, I think there has to be some flexibility for those kinds of.
I mean, there's a corridors. I mean, we all know there's corridors in North Carolina where that's heavy.
So could this be something then where you get your topics from, so we have the trainings available if that's in a specific district, like we have methamphetamine usage of, in my district or whatever, I'm just using the example. Can the superintendent's office send out a survey to the teachers of North Carolina? What would you like to see the specific training in your district? So there's actual training in that when we go to search that menu.
Yeah, the purpose is to create a system flexible enough to do exactly what you're just talking about. You know, do the teachers, what's the latest research? What's the latest issues? And what do they need to be refreshed on?
Perfect.
We haven't even talked about, and it's not in here at all, is screen addictions and social media, and I mean that's
Well,
up
and
and
that
coming.
right, and the social media aspect is one of the things in talking about suicide prevention training and mental health is something that we obviously didn't have years ago, but that a lot of experts think it's helping to drive the increase of suicides.
You've got to bob and weave with these school issues, really. Like, you've just got to be alert. Like, it's not just going to be one thing over and over.
Exactly.
Yep.
So one of the voices that I tried to bring when I presented was a parent voice. You know, of all the data sets that I have on kids and kids in school, you know, I presented data sets from parents. You know, and one of the questions that we collected data on, you know, from parents, does your child's school have enough people and resources to effectively help students with social emotional needs? 6.6% of parents, you know, said yes to that. You know, the other significant, you know, piece was that, are you sure that your child's school will get the help for your student, you know, if they have specific needs for social emotional support? And 5.2 said yes. 90% of parents that we did an environmental scan of said our local schools, wherever they are, do not have enough resources to support the needs of their children. To me, you know, that's powerful. So none of my data sets that I presented had anything to do like with the individual kids. You know, what I wanted to tap in was the voice of the parents. And the voice of the parents are saying pretty much, you know, what we're saying here. We need more people, we need more resources, and certainly we all, I think, are on the same page that we need to do that, you know, within our communities, you know, and the structures that we have within our individual communities, and working with our school boards in our community. Certainly as a school board member, that's what I did in my own community. So I think the parent voice is something we also have to recognize, as well as us as professionals, you know, what the parent lens is.
If there is one. A lot of our population, my population, they have such a disengaged parent that is what you're seeing displayed behaviorally in school, because that is probably the safest place that they have, so they act out.
Amen.
So I think this guy in the back were you behind you? Yeah.
From the parent perspective, and I understand the logic in trying to have flexibility and being able to quickly move to the issue of the day, but we said you'll be able to walk and chew gum at the same time. Suicide's been an issue. It will continue to be an issue until you deal with it. We know that the opioid crisis or human trafficking or whatever it is everybody wants to fund next year will also be a thing. But there's some things that aren't going away until we deal with them. So treating the one that is getting the most press right now is going to leave you with the same problems that you're dealing with right now.
It's a great point. Mm-hmm. It's a great point. So two can be done, you know, absolutely. Thank you.
So my question is, are y'all wanting to recommend, like, and I could just be having a misunderstanding here, like one training that covers all those topics or several trainings on those topics? I just want to make sure I'm clear here.
Our recommendation was for one unified training.
Okay.
One unified training
But
system.
that does not mean you couldn't have exactly what you're talking about. you were a teacher, I need to go find some resources.
Right.
So you could have online, what do you do with suicide, what human, and here are the symptoms for each one. So a teacher, not necessarily mandated, but just a great teacher is gonna go, I need to find some resources.
Could it be where we had one for each one?
Well, and I wonder, just taking a step back, would it be if and whether as a group everyone's on the same page as one training or multiple, but even to taking a step back from that to recognize the importance of training in these areas, and is that something that as a group we would agree on, that it is important to have for teachers and school personnel to have the training and resources on suicide prevention?
Absolutely.
I mean, you brought up earlier the importance of evidence-based interventions. It seems like we wouldn't make up a new training. I mean, surely ones exist that have been researched to be shown effective, pre and post testing, all that. It seems like we can steal from other
for any of these things, really.
Yeah, I mean, it's not like a new North Carolina specific issue.
Yeah, and it would be the responsibility of the Office of Superintendent to review those trainings and then implement them. And, remember what we're looking for. It's not just something that's going to fit for today, but something that's going to be effective 10 years down the road. So it's got to be changed. So somebody's got to have the responsibility for reviewing that training and deciding whether to implement it or not.
So the proposal here is saying 4 to 6 hours over time or at one time?
No, you start out with essentially the 6 hours of training that is required in the state board policy.
So at one time they would get
one time. So you come in the door, you've had your 6 hours, and then after that it would be 2 hours every single year. The default would be, I can't remember if it's even or odd years, would be suicide prevention. At least once every 4 years is on sexual assault, which essentially gives you 1 to 2 other spots in there, and that's why we felt like there occasionally might need to be an out because there may be emerging issues down the road. But that 6 hours would include the suicide prevention, it would include the sexual assault, it would be the comprehensive big, everybody's getting everything to begin with, and then you repeat and add new and refresh.
So could this portal
The reason there's
what's-
a minimum is because one legislator complained that we could do 2, if we say 2 hours, up to 2 hours is what it says, we could do an hour. So that's why it's there.
No, I was just, my thought about it was, and I don't claim to be an expert in implementation science, but if you take teachers who their primary focus is to educate youth, and you give them 6 hours of all of these different things, then we can check the box and say they had it, and they can walk out the door with their mind blown. How do they then implement all this great information they've been able to get back in their classroom in the real life setting when, I checked that box, I got those 6 hours, and now it's in a binder sitting on my bookshelf. And, just for myself, having taken trainings in different things, I know it's the repetitive nature of it. It's getting bits and pieces in a practical way that I can relate to, and I can learn how to work with that material versus I took, a fantastic training 3 years ago for however many hours, and so I checked the box to say I did it, but I don't do anything with that information other than pull it off my bookshelf and dust it every once.
Which is why we have the 2 hours annually.
But that's just my thought.
Yeah.
And how that will work.
That's a good point, Rachel. So is it a recommendation not to place time limits on the trainings, but essentially list it in the menu of options? So, I mean.
Well, I will say, so you could have this 4 to 6 hour program, and then your PD throughout the year, because we've got so many work days sometimes, that we can actually revisit these things during the work days, teacher work days. I mean, kids go to school 180 days. We have to be there 215 days. Kids get out June 7th this year. I get out June 22nd. So there's a lot of time in there that I could revisit some of these things. And as a working group, how are they working? How are you implementing it? To just kind of touch base with what we learned at the beginning of the year. So it's always a conversation.
I think that's how it affects culture when you have those different That's to me how it affects culture when it's an ongoing conversation and not a one-time training or even a training and then you get a refresher every 2
I agree
years.
with you.
It's an ongoing conversation of how you're implementing something in the school system, how it's practical and it looks in real life.
And I know I sound like a broken record, but that's why you have a plan. Because the plan basically assists in the coaching support, the ongoing training, the pieces that go there.
The follow through.
The follow through. And because if not, if you just have the training and you don't have a plan, then it's just like any other what we now know through implementation science and other pieces. If you just pray and spray, if we just go out and do training and then don't follow, we don't have coaching, we don't have structures in place that gather outcome data that says this is working, this isn't working, we need to adjust, not, then those things don't happen. And that's what's so crucial in trying again to not tell folks what to do, but how to do it.
Leanne, I'm sorry.
Becomes a key issue.
One of the issues, and we actually did some looking at that, I mean, a number of our teacher work days are not required. And so we have teachers who use their annual leave days on those days because that's the only time they can use them. So, I mean, we were trying to look at the scope of when we made sure we would have everyone there. And because of the way our school calendar law works, in many of our districts, especially in the western part of the state, they lose all their teacher work days during the school year because of snow. I mean, they don't have any. And so really you have to plan this around that your PD is done at the beginning of the school year. You might have some on the end, maybe a little sprinkling throughout, but I mean, it's really that 3 to 5 days that teachers are there before the school door opens.
I appreciate you trying to protect teacher time too, because that's really what I keep hearing you both say, and I.
Well, a couple points in line with that. First of all, I like Erica's idea. Why don't we first outline all the required training? Because I know for a fact there's already legislation on bully prevention, and districts are required to do that. And I don't sit here and claim I know all the training.
We actually have that document.
Okay.
We did it last year.
I think it's important to look at all the required training that are mandated in districts. The second point I'll say is that when we look at trainings, as we would refer to contemporarily nowadays as professional learning, I would agree with Bill. There's compelling evidence that our traditional model of professional learning, professional development just doesn't work. Getting teachers in a room and like flooding them with information. That if you don't have follow-up and you don't have coaching supports for a teacher, it's never going to grab on. I'm sure as a teacher you've gone to like plenty of training, right?
Amen.
But trying to go back to your classroom and actually do that without some supports or coaching is literally impossible.
Who's going to do the coaching?
Well, I think that's what we have to work into. If we're going to recommend training, I think we need to recommend, supports along with the training, because honestly, I don't care what kind of training you're doing. I've done tons of training for teachers, but do I really believe that everything I've trained has really stuck? So I think you have to embed that language, in along with the training piece, because there's no evidence anywhere that just like giving people a 2-hour workshop is going to make a difference in their behavior, in a classroom. It's just not there.
And that's where internal structures and obviously you hadn't had a good experience with MTSS, but in that MTSS framework where you have tiers of intervention and support, inside a plan, that's a place where that can work. that there is a team at that, level that brings in the folks from student services and other people to say, based on this kid's needs, we need to have this player, and that player being a part of that. And so there are internal structures that could help now that would support that. But, so their infrastructures are already there. That would not leave that as a teacher responsibility, as you as the primary teacher of that child as the essential element or the essential person in planning and doing all that. You bring in a bigger group of people to do that to help support what you're doing. So I do think that would be a worry for all teachers if they thought they're going to have to be responsible for that, and that would not be the case. So.
I'll just say one last thing, because I do think we have a tendency sometimes to really overthink stuff too and to become very complicated. And if our overall objective is that teachers and other people who are around students are cognizant of what the signs of being in trouble are, I know that there's universal groups of signs that everyone should be looking for, and that we don't necessarily have a lot of detail around all these things they need to be exposed to, but we don't need a lot of detail around sex trafficking, around suicide, or around. We're not trying to make practitioners out of school staff. We're trying to have them recognize that there is this universal group of stuff to watch for, and when you see this, then where do you go? It could also, though, I think, be part of the whole school culture. I think students should be aware of what that universal group of symptomatology is that you're looking for, those hallmark kind of things. And I do know that school nurses put out lists in some of our districts and ask teachers to refer students that they see that are having, this kind of cluster of stuff. So I want us to be careful that we're actually looking at getting to what the objective is, which is recognizing these kids, not asking people to get into a lot of detail and down into the weeds about it, and then having somewhere to go.
Thank you for saying that. That is absolutely important. And I think I'm so glad that you said that we also need to make the students aware too, because they see things a lot quicker than we do sometimes, and another peer might feel way more comfortable telling another peer something than us as the adult, which what I was saying at the beginning, another preventative piece would be that group, social, emotional group at school that gets together weekly and just talks. You don't have to do anything academic during this time. You're just some good dialogue going on, and warning signs and what to look out for in your peers. I think that's so important.
I agree.
All right, so it is 12:30, and I know a lot of y'all are hungry, so we won't keep you much longer. But in terms of next meeting, the way I envisioned this was a quick next meeting at some point in May, very quick, to actually finalize recommendations. The way to make that quick is to give you something ahead of time, like an actual draft recommendations, and you tear it apart. You say no, yes, terrible, love it, online, and then that way when we come back together, we can actually just have a debate, not have to review everything. Opposition to that?
The only thing I would say, and I would do it online too, is bringing up what Jim said about licensure, things that do not cost a dime,
Right.
and be put in place right now. Changing putting a parent or a responsible adult right there in the center of the child.
But there's nobody in this room that could change like licensure requirements.
How about we can make recommendations?
Oh.
I mean, these are just no cost recommendations that would help the field.
So, so on that note, the recommendations that I'm just going to throw out there for y'all digitally will be similar to this, and I have scribbled all over it, but this diagram with some notes and questions. It does not include the licensure, etc., but we can include that. What else? Yes.
Erica, just a point of clarification. It seems though that this document that you raised also has parallel legislation, and so it would just be really helpful that all of those pieces are together and that we understand what the connections are.
Yeah. I was not planning on touching that draft legislation, but if there's an expectation for me to, we can.
I'm just saying, it looks like there's something attached
Yeah.
to the recommendations, and so it's important to just appreciate what the implications of the
For clarification at the bottom.
Yeah.
Because we've referenced different documents and different language, and if it's a bill that's already passed the House, I wouldn't consider that draft. Unless, you know, we're gonna change it. Anyway, so just.
Oh, it's totally different than what it was in the House. By the draft we've got, I mean, it doesn't look a whole lot like what was, I mean, there's a lot of different stuff.
This isn't it?
The draft that passed the House was in the reading materials, and
Yeah.
Yeah,
this
I
is
think
different.
this is the
one that was handed
PCS,
out.
right?
This is legit.
Oh,
Yeah.
Right.
Yeah, it's,
So
it's
whatever you
different.
have,
This
just
one-
make sure we know what we're looking at.
This is a draft with changes
Oh, okay.
from what passed the House,
I see,
but what
okay.
passed the House was in the reading materials.
Yes, I saw, okay.
So was there another one passed out? Besides the one that passed out?
Right, yeah, this
The
is
one
a
that was
different
passed
draft.
out is different.
Okay.
So that is
Yeah,
true.
the one that was passed out was a PCS that Leanne and I worked on last year. Didn't see the light of day.
Yeah.
Okay, so
Yeah.
that's what I'll do. I'll send out another doodle poll for the actual meeting. But the goal with that short meeting will be to, take that document that I will send out with just like some recommendations, actually discuss it, figure out what we want it to say, and then eventually submit something to state board and the legislature. Any questions before? And I'll include all the different types of recommendations we've discussed in that document, so that's part of it. Thank y'all for coming today. I'm sorry, we're about 5 minutes over, but thanks Caroline for.
I tried.
Let me know if y'all have any questions about anything. Yeah, I think that's about it.
Thank you guys so much.
Thank you again.
Thank you.
Legislate.
I'd like to personally meet you.
Yeah.
Everything's going through the state board of education. So
Smart.
much more involved.
I'm not gonna leave that on.
You're good. Okay.
It makes sense.
That's what you see now down to what.
Gotta be smart with this stuff.
Then that part got moved
Immature students. I remember the first day I was oriented on one of our
Where do you teach in Johnston County?
Riverwood Middle.
There's only one of us.
So your Archer Lodge area?
It's like that kind of stuff. Like, you don't know me. You don't get to meet that. So,
Make sure that
Building assessment.
It's gonna get bigger than that. That area.
Yeah, she's covering her.
Yeah.
I live in South.
Because Jerry did turn around off that call and then call me. And I was in the
okay.
car between places, so, and then her phone died, so I don't know.
Yeah,
what we did.
anyway, my point is,
I appreciate you.
make sure that
Okay.
like within the DHS family, everything we do. So
I used to work.
if we need to tell.
How do y'all want to get involved?
Here, 5 people here.
You feel comfortable doing it there? You can.
Well, here, and we're talking about.
in the syllabi, you know, there's language about dress code and stuff.
Can we use that?
And usually I kind of like, you know, whatever.
Like,
But I
I
have
mean,
this
but
to
I
kids
would
to
just
say, when you're doing a presentation, you can
Steve and walk.
much less.
How are you?
You know, to-
Yes.
No, I'm good.
Okay.
I'm
Good to
good.
see you, Will.
Oh,
And
right.
look, it's almost right.
The rear end, you had that long
Not 7
I don't think either one of them was right.
Yeah, well.
I think something happened in a conversation elsewhere.
You guys do.
Okay.
She pretty much asked us. I'm fine with being here, happy to be here.
Yeah, thanks.
Nice meeting you. Thank you for what you're doing.
I'll take a picture of you. Oh, thanks for you.
That toy.
Picture my good side.
Steven selfie. Wait, before you know it,
Hey,
I'm
what's up?
seventh grader. That's all back to you.
Yeah.
in my conversation, like all of those
Gets
other
to a
people
different
have
kind
had
of
those
talk
things
about
and
it.
speak to her and their information.
My daughter is so snarky right now. Oh my gosh. Some of the things she says to my husband, I'm like, I know this is going to become a at some point.
And I wasn't there today, and then
sections of seminars.
Yeah, because and I
thought you also do.
That's right, because we were in Dr. Fitz. The advanced standing. It's broken up into two pieces. So he does a research because he's trained. You can have it. I do more of the, let's get on the same page. You're so right. Well, thank you.
Everywhere.
I really like. I've looked at the psychology of it from afar, and I was just like,
Yeah, it's a the advanced standing bridge. Just kind of let's
and now he's like, okay, I'm getting better with it, but she's like, oh, and she doesn't know why. They don't know why. Nor will I explain it to them. But it's just like,
That's kind of what it's like.
Right.
Yeah, my oldest son's twice now.
I bring in I bring in people that they are going to deal with.
She's so. We'll see. And he's such a good dad.
Yeah, obviously it's from,
but
I can't give you
yeah, he's such a good dad.
Right.
But he's going to do a youth group with him this year, and she's like, oh my God, don't tell me about youth group.
if you feel that you shouldn't have said something, or you're like, oh,
Good to
I
know
shouldn't
you're
have said that.
learn about Christianity, Henry does.
Right. This is
And
the
I know
place
how
to
to talk to your dad.
Environment.
But
I'm
it's
not
it's
putting you on
weird.
display. I'm not doing
And then
it
my
to,
son,
have
who's
everyone
8th grade, Isaac,
you're all gonna do it.
But many of the students
He's
don't even
just
get to talk to people or certain things in their internships.
in a way, but like she's on top of like school and stuff like that. Like she's a robot. Like she'll, you won't even have to
I think
ask
it really
her.
makes it
The other day I made a mistake of saying,
because,
"The best. Do you have homework
you know,
tonight?"
students are so
Mom, for the 7th year in a row.
They're so like.
I get mine done.
And I think it's hard because
Lee T.
It's not like
the
Isaac.
situation.
And
Some
Isaac's
of them
like,
do
what?
write really
What?
well.
Yeah.
It's also a generalist program. We're not expecting perfection. The best is the
Which is
assignments,
good in
which you
some
have to have
aspects,
because they
but
don't
like.
all work with a family is essentially make up
Because I want to stay on
something
it.
about
No more
family.
Fortnite, no nothing. So you get everything in.
You don't get anything out of it.
No.
Thank y'all.
And then he'll just come in from school. He'll be like, "Well, I don't have any video games to play. I might as well just go to sleep."
Right.
I probably
Oh yeah, I don't have any pluses, but
I don't either.
it's I hate that I have to stop. Is this
Thank you so much.
Thank you.
Great job.
You know,
I was looking at that clock.
I hate that.
Right.
So one is like the smallest program. You can tell she's just
Yeah.
I like that.
Yeah.
Yeah, I know, right? I know.
You either did it according to where you should be, or you didn't.
Right.
I don't know.
Yeah. No, I agree.
Like when they reject her,
Oh,
or when they, you know.
so you headed back to.
No.
Okay.
The day.
Yay!
So I was very excited about that. My kids are tracked out right now, so
I feel like
I'm
there. I
supposed to
feel
go
like
home.
there one is always left out.
Yeah.
I'm
It's
always
been a
having
busy
to
week,
focus
so
a
I'm
little,
just.
like, hey,
No.
sleep
I'm
or whatever.
so busy.
While
I'm
the
like,
other one, like, there's a
what
little
exactly am I doing this weekend?
react.
Right.
Can I make it
No,
You're not really.
there's no guidebook in how to do this. We're just all doing the best we can, just like our parents did.
You know,
We thought
you
that would be
have
it
so much
too.
on your plate. It's like you really have to find time to slow down. So.
Well, it was a pleasure to
Yeah, it's
meet
very
you.
nice to meet you too.
If you need anything, or
Same, yeah. I'm looking for, right now we only have one student on deck, I think from state, but Stephanie is, right, Francis or Stephanie?
oh yeah, Stephanie Francis. Yeah.
Is working
Yeah, she's
on.
managing the.
Yeah.
I don't mean to interrupt.
No,
I mean,
you're
just
good.
fairly really before you leave.
No.
She's like, please. do
Well,
not
why is
try
Karen
to-
Fairley right here?
I know.
Why are you her minion?
You tell her that.
And
I was like,
are you taking me to her?
Yeah, I'm going down right now.
Okay.
So if you want to,
Fairly.
She's like, I really do. Like, do not let her. And I was like, I can already tell her.
I'm out. She could chase me in the parking lot.
Lunch is
Yes, me too.
Be safe. Yeah. Hopefully it'll take me as long as
Send it out in our newsletter. So we said, and the patience of like having to sit there and do it, so you did get out. I know how that is.
Thanks, Bill.
Yeah.
So,
I just.
Oh, she's so much.
So what you're talking about, like this shape,
You must be seeing that.
Right.
It's like if you have to look towards what resources to give to the kids. Right.
Yeah. And really, where I would fall into this is, and where we actually try to go with it. First suicide prevention.
Thank you so much.
Really
for
appreciate
coming.
it.
Yes.
Oh,
I was watching the
Deanna's
clock.
cat.
Just watching the clock. Watching the clock. It's what I do all day anyways. You know, it's just an extension of my regular job. That's right. Thank you.
If there's ever anything you think needs to get to them,
Obviously, the things we're talking
I will
about.
make
but
sure.
then
Okay, great. Great job.
Oh, thanks.
Very good job.
I was telling him I just watch the clock.
When you
That's what I
get
do.
down to really looking.
I watch clocks all
Did
day.
a great job of keeping it
One of the
moving.
primary things
I
is
really
getting
appreciate
people in schools to understand is trauma-induced
Walker.
issues, and understanding trauma and understanding impact.
No, and.
That was Ann.
Ann said that, and I agree.
You know,
Sometimes it's just the KISS policy. Simple.
Drew spoke to
You
it,
can't,
but I mean,
teachers,
to me,
teachers have got to teach.
That's right.
that has to
And
be
we've got to
one of
always,
the-
sometimes
that
I'm
has
like,
to be
yes,
one
these
of the
trains are good.
things that
Then I'm
you
like, wait, that would be me. And maybe I, don't need all of that. So,
But I
Yeah.
think what,
Yeah, that's
when I
the,
was in school, you get so much.
Yeah.
But then
Right.
when you
Well,
have
I mean,
a
but the-
situation where you need it
Right.
that child.
Right.
Sit and get, and then you're done. You check
The,
them off.
the one
right,
in
but that's,
five
again, like I said, I know I sound like a broken record, but if you don't have a plan
Right.
that incorporates.
Right.
We're not
those
talking
things
about
that work.
severe, sometimes we're talking about ADD or.
Right.
Well, that's what I'm saying. That one in five is a child that's taking, I know, taking AED. And everything may be fine. They're just taking AED. I mean, they're taking Ritalin.
If you can deal with
Well, and
that.
that's what MTSS is, sadly,
That's dealt with.
We
But,
broaden,
yeah.
broaden
her experiences.
they can't get
sucks,
through
but-
that parent
Yeah, it is.
right, right. You're right. Yeah, big
Thank you.
picture.
The app, I just think that
I think it's critical to give
Critical.
kids a way that they can anonymously, right there on their phone.
right, and some of it will be a hoax, but some of it
We've gotten, we haven't gotten as many hoaxes as we thought in our
Yeah.
pilot. I mean, we got a couple, the food in the cafeteria is gonna kill me,
Yeah.
things like that.
Well, I have, I mean, this was a while back.
Hysterical.
Now, school knows Justin real well. Just in bed.
We have potential now, I mean, if
Go in, it's you that
Darren, I mean, seriously, if she follows through with what she said,
school.
that bringing together of a children's cabinet would be huge in this implementation and many other things, but.
I think the bigger problem is that districts don't treat teachers
But you got a free
and so they get all this awesome information from Bill or from Susan or whomever, and they're just like, yeah, I don't know whatever, I'll tell my parents about it later. And so as a result, like teachers
He
don't
was
know what's
working the
happening.
system.
Working the system.
What it sounds like. she's
Golly, if you
proposing
don't want to go to school that badly,
active role.
you find
She
anything, I
just
guess.
party. I mean,
Yeah.
what?
Yeah.
This kid,
But
I'm party,
Yeah.
but.
Like they will have to play an
Party
active
last
role.
night, I just didn't get up and I
So
didn't
you can't just
help.
like,
Wow.
hop in on
Wow.
TV for 15 minutes.
Well, it's good to meet
Good to
you.
meet you
I'm
too.
so glad you came.
And
Well,
obviously,
thank you,
that,
and thank you for what
her
you're
principal
doing.
trying to do was
I really have my
take
notes. I have.
MTSS and pull it down. I mean,
Exactly, that's the problem.
He took
Yeah.
some piece of it and said, this is what you're gonna do, and
You were the
just
one
everybody
that
I
else.
was the
spoke to
one.
General Assembly.
Yes.
What her program
Yeah,
is.
so I mean, I think that's why,
But it's
again,
almost like just loving.
Yeah, it's just talking
there
to
has to
them.
be a plan,
Yeah,
but
and
then
so I had
school by
one
school
of the
with it, and it
representatives
has to be a
follow me. I don't
district
know
plan.
if I told you
and
this.
then school by
Follow
school,
me when I
inside
left
that
that
district,
day.
there's
Follow me outside
implementation
of the
of a
hallway.
plan
And
with
he
outcomes that
said
are
to
being
me, he
measured
said,
so that
do
people
you
are actually,
know
and that's,
all the people that have talked here today?
you know,
Oh,
I know
my
where
God.
they're coming from a very
And I was like-
fiscally responsible place,
And he was
and
like,
they're
I just
also
want to say
looking
thank
out
you
for
for that. I'm
teachers,
like,
and
it's,
I think
we had a moment out in the hallway.
Yeah.
I'm like, let's have a moment together right now. But,
You gotta, you gotta give,
oh,
you gotta give flexibility in there, and I think
I'd love to know.
that's why I kept trying to ask what it meant.
What do you mean by flexibility?
Yeah, well, what is the
and
plan,
we
what
won't
is
see
the
some of
plan?
that for years, but it's the toll, it's
Because
taking
that-
a
it's
toll.
gotta be
in-
more
oh,
than
yeah.
just,
Acquired
this is how we're gonna do
ADHD.
this
You know, when
training.
I went through school,
Cause it's gotta have the
You can get
coaching, or
acquired,
you're not gonna miss,
right? You were
it's gotta
born
have those
But now,
determined
there's
outcomes based
acquired,
on what you
and it's
see as
acquired.
your needs in that district.
Right.
And if you're not connecting
It's
those
weird to see the
dots and
change in
creating a
kids.
strategic response,
and,
then
And they're not getting the
this all
sleep
goes
they
down
need,
the
which is
tubes
another,
every year.
well, that's
you know.
because they got the phone too.
Mhm.
Now I'll give you another one, cause my husband's
We don't want that to happen.
No, and I didn't mean that negatively.
No, you're good.
But I mean, it's just that's it's so crucial to have those piece.
Okay, I'll look at that. I mean, I think.
Thank you.
I'm not gonna use that.
Thank you so much.
That will be important
Girls
to
that
include
live
in this
Mhm.
plan.
Produce the
like
same
you said. With those
hormones.
specifics.
It's called the cuddling.
And make districts
hormone
maybe,
when you have a child.
and make
that's
them
Here's the
speak to how they
scientific
will involve parents.
that
Make them
part
speak
of
to
it.
yeah. So
Well,
more
so
than just saying,
what
here's the
are
training.
you doing for prevention?
Wow.
And that's why I kept coming back with those
It's
three
good to
things,
see
'cause
you.
Good to see you. Good to meet
Our
you.
research in doing that
So,
white paper.
briefly,
Y'all did good work on
Yeah,
that too.
I mean, that
But I
is
was
what
talking to
that
Karen
said.
fairly about
The research said, you've got to do prevention, you've got to have that primary intervention, you've got to have
And Karen and I
either
was talking to her on the phone. She's
the
like,
rest
"Oh
of
my
the
God,
continuum
kids."
inside the building,
Yeah.
and nobody really wants them to do
She knows how to do
mental health,
grants.
Any
in
legislation,
schools
any
as a
legislation,
mental health agency.
any new policies
But you
coming
got,
down,
but you got to have that linkage, which was the
with
referral
the-
part, to
with
get
us,
those kids
with,
to those
you know,
pieces.
General Assembly,
So-
whatever. Who
I
is
mean, that's the
making
thing, it's like,
sure
there's always gonna be a ball dropped.
overwhelming for the
Yeah.
districts,
And
the
it's
principals
how
and the
can we
teachers
make
say,
sure that doesn't
okay, what do we need
Well,
to do?
and
What
how
are
do
we
you
doing? We
cover
don't know
for
all
it?
these.
Yeah.
Yeah, so, because
To
you're
where
still gonna
you could
drop them.
have a
But,
staff
but if you've
of
got
school
enough
safety and mental health
things
coordinators
down
that are
underneath,
sure the check
you catch it
box, sure the
somewhere.
neutrality
Right,
is
that's
there.
true.
And so,
Sure, checklist is
so
being
anyway.
done.
Oh, yeah.
The school
Here you
just
go.
said, yeah,
Well, thanks, Bill. I
Yeah.
appreciate it.
Yeah.
Yeah, and
we need these people.
Did you go all the way down there?
I know, I just got that
Two
one.
different
obviously
districts
impassioned
or
here, so
whatever.
anytime
Go
you
into each school,
just wanna
hasn't
I
been
love
done.
it.
Go to do spot
Yes.
checks.
I'm around
Make sure
most
it's
of the
done.
time.
Oh,
Awesome.
here's
Okay,
the
thank
legislation
you.
just
Yeah.
came down.
Thank
This is
you.
what you
You
need.
too. Well, I'm just
Instead of
like, I'm
people
really
filling
grateful
out
that you're
the
just
dark right here,
like
making
you.
sure that,
you
what
bring
do
it
I
back
need to do? I don't even know
pictures.
anymore.
That's
You just
Thanks.
change it.
Thank
Because
you.
it is changing.
All right, see ya. Thank you.
So how do we ensure that the schools are actually doing what the legislation is? And so to have those, I was telling her about the little diagram I did here with school safety and mental health coordinators. And having like 2 or 3 people up there, or 5 people, I don't know, over those 2 or 3 districts that are just deployed and making sure that they're all hitting those things. I just think it would just be.
School safety reinforcers.
That's right. Yeah, I just think that that's, especially if we are able to get portions of this checklist through so we can have a certification, it's just really, that's going to be our thing.
Mhm.
That's going to be our thing. But then the second thing is, what is the implementation logistics of this? And what is the follow-through? And that is money with those school safety, whatever, school safety saviors, can be that follow-through. Because it's the biggest thing with any legislation, is who's making sure it's being done and enacted. And so the implementation of that, okay, we've got that too. So we're going to need money for those coordinators. So if you could throw that in there too, that'd be great. I don't know. I just think it simplifies it. And then they take care of the people out from under them. What do you think? I mean,
Right, so, most district has a school safety coordinator.
But this would be, I kind of over that. It would be like a kind of team with the checks and balances to make sure of everything.
It would be, they would look at the mental health, the climate, and the physical.
Mhm.
It wouldn't just be more like the school safety coordinator is more, physical security related.
Correct. These people would be our checklist.
Yeah,
Oh. Oh, okay.
You're good. You're fine, but
Yeah.
just FYI.
Right. We won't talk
Didn't we talk
junk about people. Oh God, have I already? I can't remember. But yeah, so I just think that would be the checklist. I had a meeting with my, and I've told Karen this, had a meeting with my superintendent who's coming next week, this with Dr. Pro and Dr. Robertson also, I think our lead operation manager is coming too. And when we talked about this, he was like, checklist. That's great. So these things, everything on that list is something that's attainable for whatever county they want to work in, whatever county across the all of those things are attainable.
they'll be broad and they'll be basic.
Absolutely.
Yeah.
Absolutely. And it's things we all should be doing